Good morning, good afternoon, and good evening, Your Excellencies, colleagues, ladies and gentlemen. It is with great pleasure that I welcome you and declare open the 148th session of the Executive Board of WHO. I extend to you and your families my best wishes for the new year. Distinguished members of the WHO Executive Board, Honorable Ministers, Excellencies and Member State Representatives, WHO Director General, Regional Director of WHO Southeast Asia and other regional directors, heads and representatives of UN agencies and partner organizations. A very warm welcome to all of you at the 148th session of the WHO Executive Board. This is our first meeting in 2021, and we can all see that a dawn of optimism is already breaking. My best wishes to all of you and your families and the people of your respective nations for a healthy, safe, and successful New Year 2021. It is only natural that while we are all gathered here, we must express our profound condolences to and solidarity with the families and societies whose people have lost their lives to the disease, those who are battling for their survival, and those whose lives and livelihoods have been affected by the crisis. We must also never lose a chance to thank the medical professionals, scientists, and researchers, as well as other essential workers around the world who continue working under difficult and challenging circumstances to deal with the pandemic. We all know how difficult the year 2020 has been for the whole world, of how humanity has battled this crisis with all its might. But it has also been a year in which the wisdom and evidence of science was judiciously adopted. I call the year 2020 as a year of science, a year of incredible scientific achievement. In less than 12 months, researchers have characterized a novel illness, sequenced a new virus's genome, developed diagnostics, produced treatment protocols, and established the efficacy of drugs and vaccines in randomized controlled trials. A big shout out to our scientists and researchers. We have seen the global scientific capabilities race against time and deliver on their promise of a vaccine in the shortest possible time in history. While 2020 is described as the year of science, the year 2021 shall be the year of global solidarity and survival. I am sure that it will be the harbinger of a decade of action. The speed at which COVID-19 vaccines are being successfully produced across many countries, prominent breakthroughs are taking place. A tech investment boom is being witnessed, and digital technologies are being adopted. All this is combining to raise hopes of a new era of progress. I want to express utmost optimism that this year the unprecedented crisis caused by the COVID-19 pandemic shall be mitigated and successfully reversed through committed political leadership and sustained global cooperation and solidarity. This year, we shall see intensified international cooperation to contain, mitigate, and defeat the pandemic using enhanced scientific knowledge and best practices. This year has brought hope. The recent breakthroughs on COVID 19 vaccines offer a ray of hope, but that ray of hope needs to reach everyone. We have to recognize that the poorest and the most vulnerable are the hardest hit by the pandemic, and that the impact of the crisis will reverse hard won development gains and hamper progress towards achieving the sustainable development goals. Therefore, we must ensure fair and equitable distribution of the COVID vaccines. While on the chapter of gratitude, I would also like to acknowledge the crucial role played by the World Health Organization and all its staff and members in catalyzing and containing and coordinating the global response to control and contain the spread of COVID 19. Excellencies and distinguished delegates, your presence here today reflects your commitment to being actively involved in WHO's governance. As global public health leaders, this platform of the World Health Organization Executive Board is extremely important since it binds us all together and enables us to set the directions and agenda and continue striving for our objective of health as a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. We all know that the hard work and determination of WHO member states have saved countless lives, improved public health, and increased life expectancy. The solidarity and cooperation that has defined our work for 7 decades has been central to the COVID 19 response. The values expressed in World Health Assembly resolution on COVID 19 response have continued to guide the work of WHO and its member states, and we will be apprised of the progress in the implementation during the course of this session. While COVID 19 has revealed the need to invest in health and the call for sustainable funding to WHO to ensure that the organization can fully respond to public health needs, any proposed increase in budget needs to also consider the global economic impact of COVID 19. We all know that the pandemic has affected the economies of countries globally. However, it has also presented us with an opportunity whereby health has been placed central on the global agenda of governments, partners, and donors. Excellencies, distinguished delegates, and partners, COVID 19 has provided a new lens through which to view how healthcare is delivered and what is possible to achieve. How can we seize this once in a generation opportunity to realize our shortcomings and yet at the same time seize the opportunities? I have mentioned on earlier occasions also and would like to reiterate that as chairperson of the executive board, my focus is on equitable, affordable, and accessible healthcare for all, particularly to protect the health of those without wealth. You will agree with me that there is always a scope of improvement in what we have done. We improve ourselves by learning lessons from the past and by imagining the future. We need to see what worked best and what reforms we should make for a better tomorrow. We can find satisfaction in the fact that collectively we faced unprecedented challenges with resilience, even as we were grappling with uncertainties and the fact that essential healthcare services continued despite setbacks in the initial response period. However, we need to do much more going forward. While each country has its unique approach in dealing with public health based on the strengths of their existing health systems and national policies and programs, I am sure that together we will continue to bring about improvements aligned with our collective discussions. The response to this pandemic has been stressful and challenging, and we will continue to be asked to deliver our best in the ongoing response and beyond into the recovery phase. Excellencies, before I end, I would like to compliment the Director General and the regional directors for deciding to award the 2020 DG's Award for Excellence to all members of the WHO workforce. It is indeed a very thoughtful decision, and for the exceptional contributions made by all the WHO staff in supporting the pandemic response, a well-deserved achievement. My friends, the beginning of this year has been a very humbling experience. The last 20 days have been a victory for science and humanity. People have started getting vaccinated across many countries of the world, and that's overwhelming. Hopes are high, but there is still much to learn and many barriers to overcome. New cases of COVID-19 continue to be recorded. There is no room for complacency. Today, I call upon all of you to renew your commitment to help people and societies in special situations, especially the weakest and the most vulnerable, and recognize that many governments have offered their assistance and support to others in a spirit of solidarity and mutual support. Today, let us also pledge our commitment to the decade of action and delivery for sustainable development and continue relentlessly to work to mobilize a coordinated global response to the pandemic. Today, all governments must rise to the challenge. Only then faster growth and higher living standards will be within their reach. The 2020s began with a cry of pain, but with the right policies, the decade could end with a roar. I once again thank all of you for reposing your faith and trust in me and look forward to our discussions in this session. Many thanks for granting me the privilege of addressing all of you. Thank you. Colleagues, due to the current restrictions imposed in response to COVID-19, EB 148 will be held virtually. Before we proceed, I would like to say a few words about the virtual platform. Participants on the virtual platform may request the floor by raising their hands. This involves clicking on the icon labeled Participants at the bottom of the screen and then clicking on the button labeled Raise Hand. In terms of procedural motions, member states wishing to raise a point of order or exercise a right of reply should do so by sending a message to the following telephone number by SMS text or by WhatsApp: +4179 467 2870. I repeat, +4179 467 2870. The number is the same that member states used during other recent governing body meetings, and it may be used for points of order, requests for rights of reply, or other procedural motions only. It may not be used for any other matter. The telephone number can also be found in the practical guide for decision making and procedural issues on the virtual system contained in the document EB 148/info/5. Special procedures to regulate the conduct of this virtual meeting. We shall now take up the draft decision contained in document EB 148/2 concerning the special procedures to regulate the conduct of this virtual session of the Executive Board. May I take it that the Executive Board is ready to adopt the special procedures contained in document EB 148/2 and to apply them to this meeting? I see no objection. The decision is therefore adopted. The special procedures set out, among other things, how delegations may address the meeting. In addition, please note that as in a physical meeting within member states' delegations, the matter of authorization to take the floor is a matter for the delegation itself. Accordingly, and in line with normal practice, if an alternate or an advisor who has been duly registered as part of the delegation presents themselves to speak or vote on behalf of a delegation, it will be assumed that they are authorized by the delegation to do so. In addition, I would like to make clear that I propose to accord the right of reply if sought at the end of each day. Delegates are kindly required to keep their interventions as brief as possible, and in the interest of time, it would be appreciated if the interventions could be limited to up to 3 minutes. May I take it that the board is content to proceed on this basis? I see no objections. Let us now turn to the consideration of the agenda for this session of the board. In accordance with the provisions of the rules of procedure, the board has before it this season's provisional agenda contained in documents EB 148/1 and EB 148/1 annotated. In accordance with Rule 8 of the Rules of Procedure of the Executive Board, the officers of the board met with the Director General on 16th September 2020 to review the draft provisional agenda of the 148th session of the board that had been circulated to member states on 19th June 2020. Proposals received from member states by the deadline of 11th September 2020 were considered. Following the resumed 73rd meeting of the World Health Assembly, the officers of the board and the Director General met again on 27th November 2020 to review an updated version of the draft provisional agenda. You will find the details of the consultations and the recommendations on page 8 to 10 of the English version of the document EB 148/1 annotated. I now wish to draw your attention to item 17.5. This is amendments to the financial regulations and financial rules, if any. The Secretariat has informed me that there are no amendments to the financial regulations and financial rules. In view of this, I propose that this agenda item be deleted. May I take it that this proposal is acceptable? I see no objection. It is so decided. Are there any further comments on the provisional agenda? Thank you. The agenda is therefore adopted. I understand that the delegation of Austria has requested to take the floor. Austria, you have the floor. Are there any objections to this proposal from Austria? I see no objections. As you know, EB 148 has a heavy agenda with 48 items and sub-items and more than 22 draft resolutions and decisions to be examined. It is important that we hold the meeting in a constructive manner. I would like to inform you that the individual statements by members of the board will be limited to 3 minutes. Individual statements by all member states not represented on the board and associate members will be limited to 2 minutes. Statements by observers, invited representatives of the United Nations and other participating intergovernmental organizations and non-state actors in official relations with WHO will be limited to 1 minute. Regional and group statements will be limited to 4 minutes. When we move to the agenda items considered last week by the PBAC, I propose to build on the good work of that committee by focusing on discussion on the PBAC report and its recommendations rather than having another full discussion of each of the documents. May I take it that these proposals are acceptable? I see no objections. It is so decided. Let us now review the preliminary daily timetable contained in document EB 148/DIV/2. After we complete our discussion of item 1, we will take up item 2, the report of the Director General, and the Director General will present his report. Then we will consider item 3, report of the regional committees to the Executive Board. Next, we will turn to Pillar 2 and take up item 14, Public Health Emergencies, Preparedness and Response. We will consider sub-item 14.1, COVID-19 Response, and a technical update will be provided by the Secretariat. We will then consider sub-item 14.2, WHO's work in health emergencies, and updates by the chairpersons of the various review processes will be provided. When we turn to Pillar 4 and take up agenda item 4, report of the Program, Budget and Administration Committee of the Executive Board, an update on the prevention of sexual harassment and abuse will be provided following our consideration of the report. In terms of items that will be taken up together, the provisional daily timetable proposes the following. Under Pillar 1, Item 10, Substandard and Falsified Medical Products, and Item 11, Standardization of Medical Devices Nomenclature will be considered together. Under Pillar 2, Sub-Items 15.1, Poliomyelitis Eradication, and 15.2, Polio Transition Planning and Post-Polio Certification will be considered together. Under pillar 4, I propose that sub-items 17.2 update on the financing and implementation of the program budget 2020-21 and 17.1 proposed program budget 2022-23 be taken together. Consideration of these sub-items will be followed by a separate discussion on sustainable financing. We will also take sub-items 17.3 scale of assessments 2022-23 and 17.4 status of collection of assessed contributions together. Similarly, under item 21 staffing matters, I propose that we take together the following sub-items. 21.1 statement by the representatives of the WHO staff associations. 21.2 report of the Ombudsman. 21.3 human resources update. 21.4 amendments to the staff regulations and staff rules. 21.5 report of the International Civil Service Commission. Do I take it that the board agrees with these proposals? I see no objection. It is so decided. I propose that the board meet from 10 a.m. to 13 a.m. p.m. and from 2 p.m. to 5 p.m. Geneva time. There will be a maximum of 2 sessions each day. It is also useful to recall decision EB 147-6, in which the executive board decided that this session of the board should close no later than Tuesday 26th January 2021. Do I take it that the board agrees with the timetable? As I see no objection, it is so decided. When delivering statements, I would like to remind delegates to speak at a moderate speed that allows for its interpretation and ensures their message is conveyed clearly and accurately. Please send a copy of your written statements in advance to the email address interpret@who.int. This does not prevent you from making changes on delivery, but will facilitate clarity and accuracy in all languages. If you want your statement to be posted on the WHO website, or if you have a longer statement with information you would like to share additionally, you may send it to the email address statements@who.int. Please note that written statements will not be included in the summary record of the meeting. May I take it that these proposals are acceptable? I see no objection. It is so decided. This concludes our consideration of agenda item 1. Now let us turn to the next agenda item. Let us consider item 2 of our agenda, report by the Director General. I have pleasure in giving the floor to the Director General. Dr. Tedros, you have the floor, please.
Thank you. Thank you, Your Excellency. Thank you for your leadership during these difficult times, Your Excellency Dr. Vardhan, Chair of the Executive Board. And Excellencies, dear colleagues and friends, good morning, good afternoon, and good evening to you all, and a Happy New Year. 40 years ago, a new virus emerged and sparked a pandemic. Life-saving medicines were developed, but more than a decade passed before the world's poor got access to them. 12 years ago, a new virus emerged and sparked a pandemic. Life-saving vaccines were developed, but by the time the world's poor got access, the pandemic was over. 1 year ago, a new virus emerged and sparked a pandemic. Life-saving vaccines had been developed. What happens next is up to us. We have an opportunity to beat history, to write a different story, to avoid the mistakes of the HIV and H1N1 pandemics. The development and approval of safe and effective vaccines less than a year after the emergence of a new virus is a stunning scientific achievement and a much needed source of hope. Vaccines are the shot in the arm we all need, literally and figuratively. The recent emergence of rapidly spreading variants makes the rapid and equitable rollout of vaccines all the more important. But we now face the real danger that even as vaccines bring hope to some, they become another brick in the wall of inequality between the world's haves and have-nots. It's right that all governments want to prioritize vaccinating their own health workers and older people first. But it's not right that younger, healthier adults in rich countries are vaccinated before health workers and older people in poorer countries. There will be enough vaccine for everyone, but right now, we must work together as one global family to prioritize those most at risk of severe disease and death in all countries. For the past 9 months, the ACT Accelerator and the COVAX Vaccines Pillar have been laying the groundwork for the equitable distribution and deployment of vaccines. We have overcome scientific barriers, legal barriers, logistical barriers, and regulatory barriers. We have secured 2 billion doses from 5 producers with options on more than 1 billion more doses, and we aim to start deliveries in February. I use this opportunity to thank Gavi and CEPI. COVAX is ready to deliver what it was created for. But in recent weeks, I have heard from several member states who have questioned whether COVAX will get the vaccines it needs and whether high-income countries will keep the promises they have made. As the first vaccines begin to be deployed, the promise of equitable access is at serious risk. More than 39 million doses of vaccine have now been administered in at least 49 higher income countries. Just 25 doses have been given in one lowest income country. Not 25 million, not 25,000, just 25. I need to be blunt. The world is on the brink of a catastrophic moral failure. And the price of this failure will be paid with lives and livelihoods in the world's poorest countries. Even as they speak the language of equitable access, some countries and companies continue to prioritize bilateral deals, going around COVAX, driving up prices, and attempting to jump to the front of the queue. This is wrong. 44 bilateral deals were signed last year, and at least 12 have already been signed this year. The situation is compounded by the fact that most manufacturers have prioritized regulatory approval in rich countries where the profits are highest, rather than submitting full dossiers to WHO. This could delay COVAX deliveries and create exactly the scenario COVAX was designed to avoid, with hoarding, a chaotic market, an uncoordinated response, and continued social and economic disruption. Not only does this me-first approach leave the world's poorest and most vulnerable people at risk, it's also self-defeating. Ultimately, these actions will only prolong the pandemic, prolong our pain. The restrictions needed to contain it, and human and economic suffering. Vaccine equity is not just a moral imperative. It is a strategic and economic imperative, and we know it. A recent study estimated that the economic benefits of equitable vaccine allocation for 10 high-income countries would be at least $153 billion in 2021, rising to $466 billion by 2025. That's more than 12 times the total cost of the ACT accelerator. It's not too late. I call on all countries to work together in solidarity to ensure that within the first 100 days of this year, vaccination of health workers and older people is underway in all countries. It's in the best interest of each and every nation on earth. Together, we must change the rules of the game in 3 ways. First, we call on countries with bilateral contracts and control of supply to be transparent on these contracts with COVAX, including on volumes, pricing, and delivery dates. We call on these countries to give much greater priority to COVAX's place in the queue and to share their own doses with COVAX, especially once they have vaccinated their own health workers and older populations, so that other countries can do the same. Second, we call on vaccine producers to provide WHO with full data for regulatory review in real time to accelerate approvals. We also call on producers to allow countries with bilateral contracts to share doses with COVAX and to prioritize supplying COVAX rather than new bilateral deals. And third, we call on all countries introducing vaccines to only use vaccines that meet rigorous international standards for safety, efficacy, and quality, and to accelerate readiness for deployment. The theme for World Health Day this year is health inequality. My challenge to all member states is to ensure that by the time World Health Day arrives on the 7th of April, COVID-19 vaccines are being administered in every country as a symbol of hope for overcoming both the pandemic and the inequalities that lie at the root of so many global health challenges. I hope this will be realized. Excellencies, dear colleagues and friends, the pandemic has lessons for all of us, for every member state, and for the Secretariat. All of us must have the humility to learn, to change, to innovate, and to grow. The work of the Independent Panel for Pandemic Preparedness and Response, the Review Committee of the International Health Regulations, and the Independent Oversight Advisory Committee of the WHO Health Emergencies Program will all have recommendations for member states and the Secretariat. But several lessons are already staring us in the face. First, preparedness and response. COVID-19 surprised even some of the world's richest and most powerful nations. It caught them unprepared and revealed a collective failure to invest in emergency preparedness. Even before the pandemic, WHO was working to strengthen preparedness and response as part of our transformation, knowing that the next pandemic was just a matter of when, not if. With the World Bank, we established the Global Preparedness Monitoring Board 2 years ago. We created a new division of emergency preparedness, a new science division, and we developed new digital tools for surveillance and early warning. In the past year, we have taken further steps, which are described in our report to you for this meeting. At the World Health Assembly in November, I announced the creation of a new repository for specimens at a secure facility in Switzerland to facilitate the voluntary sharing of viruses and the rapid development of medical countermeasures. We're calling it the BioHub. I'm pleased to say that in addition to previous commitments from Italy and Thailand, South Africa has now committed to share samples of the new SARS-CoV-2 variant with the BioHub. We encourage all member states to share data and samples of the new variants in a timely way. In November, I also proposed a new mechanism for strengthening preparedness based on mutual trust and mutual accountability, the Universal Health Preparedness Review. And I thank Benin and the Central African Republic for proposing the idea on behalf of the Africa Group. Previous tools such as joint external evaluations based on expert review of national preparedness have value, but the pandemic has shown they have not been sufficient. The Universal Health and Preparedness Review is based on a voluntary mechanism of peer-to-peer review, led by member states to promote greater, more effective international cooperation by bringing nations and stakeholders together in a spirit of solidarity. In December, we briefed member states on the UHPR. We have begun discussions to develop the tool, and in the coming weeks, we plan to begin a pilot phase with the first group of countries that have volunteered. We encourage all countries to engage actively and to help us build this initiative together. The second key lesson the pandemic is teaching us is that the health of humans, animals, and the planet are intimately intertwined. We can only protect and promote human health by fundamentally enhancing the monitoring and management of the risks at the interface between humans, animals, and ecosystems. This is not a new idea. but the pandemic has brought it into sharper focus. More than 70% of emerging diseases discovered in recent years are linked to animal to human transmission. More than a decade ago, WHO, the Food and Agriculture Organization of the United Nations, and the World Organization for Animal Health came together at the tripartite to develop and promote the One Health concept. The pandemic has shown that we must take our partnership to a new level and that it must become more than a concept. It must be translated into systems that keep people safer in countries. It's also clear that One Health must be about more than zoonosis. It must address the full range of issues that affect the relationship between humans, animals, and planet, including deforestation, intensive agriculture, pollution, climate change, and so on. Together with our partners in the tripartite and the UN environment, we have now agreed to establish a One Health high-level expert council supported by a joint secretariat. The council will analyze scientific evidence and policy responses in countries and advise the 4 agencies on actions to take and recommendations to develop. Its first priority will be to examine and advise on immediate priorities for the prevention, prediction, detection, monitoring, and response to emerging zoonosis with epidemic and pandemic potential. We expect the first meeting of the Council by the World Health Assembly in May, and we will keep you updated as the Council and its agenda takes shape. At the same time, we must translate this high-level work into concrete systems at the most local level possible to pick up signals of new outbreaks and contain them at source where possible. At last year's assembly, member states also requested the Secretariat to work with our partners to identify the zoonotic source of the virus. As you know, 14 members of the international mission studying the origin of the virus have now arrived in China. Another 3 are working with the team remotely. No one should be in any doubt that this is a scientific exercise. The objective is to understand how and when this new coronavirus emerged, so that we can all take steps to prevent the emergence of other zoonotic pathogens in future. The third major lesson the pandemic is teaching us is that the world needs a strong WHO. Again, this is not a new realization. Those of us who have been working in global health for any length of time know the strengths and weaknesses of WHO. The strengthening WHO is the focus of the transformation journey that we have been on together for the past 3.5 years. I provided an update on transformation in my remarks at the Assembly in November. I also refer you to the detailed progress report we published in December, and we look forward to your further feedback this week on the paper on transforming for enhanced country impact. We appreciate the broad support for transformation expressed by member states to date. And we welcome the comments made by the chair of the Independent Expert Oversight Advisory Committee during PBAC last week that transformation is delivering results. But we have also heard your call for more focus on transformational impact in countries. Transformation is a journey. We have already come a long way, and we still have further to travel. In the coming year, we will continue to learn, to change, and to listen. As you know, at the end of last year, the regional directors and I decided to award the WHO Award of Excellence to the entire WHO workforce for their extraordinary efforts in the most extraordinary year, as our board chair, Dr. Vardhan, indicated in his speech. And in recognition of 2021, at the International Year of Health and Care Workers, we have also decided to make 2021 the year of the workforce, to focus on making WHO an organization that attracts the best people, gives them the best environment, inclusive, diverse, and enables and empowers them to do and be their best. Member states have themselves identified that one of the biggest barriers to WHO being the best it can be is sustainable and predictable financing. We know member states are serious about strengthening WHO, so they must be serious about sustaining sustainable financing and about addressing the gulf between what is expected of us and the sources we have to do it. I would like to thank France and Germany for taking the lead on this issue. As you know, the Secretariat has made significant efforts to address this issue through the first WHO investment case, a new resource mobilization strategy, the first Partners Forum, and most recently through the formation of the WHO Foundation as part of the transformation which we started in 2017. The WHO Foundation is an independent legal entity that aims to generate $1 billion in the next 3 years from sources that WHO has not accessed before. Between 70 and 80% of those funds will be for WHO, and the remainder will be for other public health organizations focused on civil societies. The foundation has a strong board led by Dr. Thomas Zeltner, with representation from all regions, and its first chief executive officer, Anil Soni, began his work at the beginning of this year. We anticipate that the foundation will help to diversify WHO's donor base and will be a source of further flexible funding. Some of the strategic solutions that we proposed during the diagnosis when we started the transformation. However, there is still much work to be done to ensure WHO has sustainable and predictable funding it needs. This week, you will consider a proposal to establish an inclusive working group to define the principles for what should be funded, develop options for how much funding is needed, and consider how those priorities should be funded. If agreed by member states, the working group could consider a proposal that will come back to this board before going forward to the World Health Assembly in 2022. We're committed to accountability and to giving you value for money. And it's the right thing to do. But we ask our member states to ensure the Secretariat receives adequate money for value. Even as we work relentlessly towards ending the pandemic and responding to other emergencies, we will continue to transform to deliver an impact where it matters most, in countries. Your agenda this week reflects the immense scope of WHO's work, including patient safety, non-communicable diseases, oral health, eye care, antimicrobial resistance, orphan diseases, substandard and falsified medical products, mental health, polio, immunization, and much, much more. I know that some member states have concerns about the late publication of documents for this meeting. I personally apologize for any difficulty this has caused in your preparations. We remain committed to timely delivery of governing bodies' documents, and we have made very good progress in this area. We seek your understanding given the exceptional circumstances under which our staff have been working, and the very tight turnaround between the resumed World Health Assembly in November and this session of the Executive Board. We look forward to a constructive discussion this week as we work together to address the myriad other health challenges the world's people face every single day. By the end of this year, we expect to deliver up to 90% of the work we committed to at the beginning of the biennium. To respond to the disruption to essential health services in many member states, WHO is implementing a boost initiative to assign staff virtually from headquarters to work with regional and country offices in line with country needs. Full alignment of the 3 levels of WHO. In the first phase, staff have been assigned to 20 countries for system and community strengthening, financing, diagnostics, therapeutics, surveillance, and more. We will continue to support countries to progress towards universal health coverage through intensified technical assistance for primary health care and to maintain essential health services, including for immunization and sexual, reproductive, maternal, newborn, child, and adolescent health. We will support member states to protect and expand fragile gains against HIV, TB, malaria, hepatitis, sexually transmitted infections, and neglected tropical diseases. We will implement the global strategy to accelerate the elimination of cervical cancer approved by member states in November. We will intensify our support for countries to progressively cover 1 billion additional people living with NCDs and mental health conditions by 2023 with essential health services and medicines. Despite setbacks last year, we remain totally committed to the twin priorities of polio eradication and polio transition, and to using polio infrastructure for the rollout of COVID-19 vaccines. At the request of member states, we are developing new strategic policy directions for nursing and midwifery. In light of the significant toll that COVID-19 has taken on older people and to increase the quality of care they receive, we're studying the organization and financing of long-term care systems. We will continue strengthening country capacity to implement national action plans for antimicrobial resistance while strengthening surveillance of AMR and antimicrobial consumption. In response to increasing requests from member states, we will work to strengthen local production of and access to quality, safe, effective, and affordable medicines and other health products. Following approval of the global strategy on digital health, we are developing tools to support member states to implement national digital health strategies, including a digital vaccination certificate. We will work with countries to implement the policy prescriptions recommended in the Manifesto for a Healthy and Green Recovery. In June, we will host a virtual health summit for small island developing states, focusing on resilient health systems that can respond to the twin threats of non-communicable diseases and climate change. We will support national health data system strengthening through the SCORE technical package. We will continue to hold ourselves accountable through delivery stocktakes to track progress towards the 3 billion targets. We will strengthen the development of normative guidance to ensure it's timely, relevant, based on the latest evidence, and easy to access. We will strengthen capacity for high-quality ethical research in all countries and ensure accelerated scaling of innovations and health products to meet public health needs. And we will continue to strengthen collaboration with our multilateral partners through the Global Action Plan on Health and Well-being for All to reinforce vaccine equity, drive recovery, and support member states to get back on track for the sustainable development goals. At the same time, we're also looking ahead to the next biennium, which is supported by the draft program budget for 2022 and 2023 that you will be considering this week. The draft budget reflects the need to forge ahead with the work we have to do, implementing the lessons we have already learned from the pandemic, even while we wait for the recommendations of various review processes. We have therefore developed a flexible program budget built around 4 key strategic themes. First, the urgent need to accelerate progress towards the triple billion targets and the sustainable development goals, including appropriate resourcing of country offices. Second, the need to strengthen health emergency preparedness and response at all levels. Third, the need to build resilience through stronger primary health care as a foundation of both health security and universal health coverage. And fourth, the need to advance WHO's leadership in science and data. The budget document explains each of these themes in more detail. It also proposes extending the deadline for the triple billion targets by 2 years to 2025. Extending the deadline will allow us to identify the specific areas in which countries are lagging behind and potential solutions to accelerate progress. Excellencies, dear colleagues and friends, 1 year into the greatest crisis of our time, there is no question that we still face unprecedented danger. But we also have an unprecedented opportunity to make health the heartbeat of development and the foundation of a more secure and more equitable world. In the past year, we have lost more than 2 million of our sisters and brothers to this pandemic, including many health workers who gave their lives in the service of others. We have also lost colleagues, including Belinda Kasongo, murdered in DRC as she worked to protect others from Ebola. Her sacrifice was not in vain. It was because people like Belinda put themselves in danger that we were able to end the Ebola outbreak in Eastern DRC, one of the most complicated emergencies we have faced. And next week marks 1 year since the passing of our dear friend and colleague Pete Salama. Gone but never forgotten. His legacy lives on. We owe it to all of them to ensure that whatever challenges we face, we overcome them. Whatever lessons the pandemic is teaching us, we learn them. And whatever opportunities we have to build a healthier, safer, fairer world, we take them. I thank you.
Thank you, Your Excellency, Mr. Chair. May we kindly remind those wishing to make an intervention to please raise their hand in the Zoom platform. I should now like to call upon the distinguished delegate of Burkina Faso to be followed by Austria and Finland. Thank you. Burkina Faso, you have the floor.
Thank you very much. Chairman, Burkina Faso has the honor to make this statement under Agenda Item 2 on behalf of the 47 member states of the WHO's African region. The African region would like to thank the Director General for his detailed report on the action taken by the organization in the context of the COVID-19 pandemic, and we'd like to congratulate him for his leadership in managing world health. We also pay tribute to the Secretariat, which has worked so very, very hard to support member states despite the very difficult circumstances in which it's working at the moment as a result of the pandemic. We support the ongoing process of transformation within the organization. We also welcome the efforts of the Independent Group on Preparation for and Response to Pandemics in evaluating the work that the organization has done to tackle COVID-19. We urge WHO to conclude its work on looking at the origins of COVID-19 as quickly as possible and urge it to do whatever is required to prevent the emergence of other pandemics in the future and help states to prepare for them. We urge everybody involved in world public health to work together with the organization and provide it with sufficient funds for it to do its job. Chairman, turning to the issue of the distribution of a COVID-19 vaccine, the African region is rather concerned that the vaccine is being hoovered up by just a few countries, and we'd like to stress the need for the vaccine against COVID-19 to be considered as a global public good. As the Director General has quite rightly said, nobody will be safe until everybody is safe. That's why we encourage member states to give priority to international solidarity and take the steps which are required to make the entire world safe from the pandemic. The member states of the African region would like to underscore the urgent need for equitable vaccine distribution to all countries, whatever their level of development. African countries did quickly put measures in place in order to control the spread of COVID-19 and thereby limit its negative impact on their peoples and on their economies. Furthermore, the African region would like to emphasize that the COVID-19 situation should not make us lose sight of the priority that should be attached to controlling other endemic diseases such as malaria, tuberculosis, HIV/AIDS, neglected tropical diseases, non-communicable diseases, and cancers worldwide, especially in those countries most hard hit by them. Chairman, because of the negative impact of the COVID-19 pandemic, further efforts are going to have to be made by countries in order to provide WHO with the resources she needs to ensure that the program budget for 2022-2023 can fully implement the 13th General Program of Work. We encourage the organization to continue to look for sustainable and innovative sources of financing which will help it to be stronger and more effective in carrying out its mission. Thank you.
Thank you very much. And now to Austria, to be followed by Finland.
Mr. President, I have the honor of speaking on behalf of the EU and its member states, and the candidate countries, the Republic of North Macedonia, Montenegro and Albania, as well as the Ukraine and the Republic of Moldova align themselves with this statement. The EU and its member states welcome the global coordination, commitment and leadership of WHO, especially in response to the COVID-19 pandemic. Its action has been a safeguard for the most vulnerable populations, addressing gender and health inequalities, ensuring access to essential health services, and decreasing pandemic-related morbidity and mortality. We encourage WHO to continue applying a transparent, accountable approach to its action. We thank the DG for his report and remain fully committed to continue collaborating with WHO and regional office supporting WHO in its role as the leading global health agency now and beyond the current pandemic. A year into the pandemic, we have learned that collaboration, resolve and commitment on a global scale delivers results. We praise all singular and collective actors that contributed to the unprecedentedly fast discovery of effective vaccines, as well as the work to provide equitable access to vaccines and other necessary commodities. It remains crucial that no one is left behind, especially in fragile, low-resource settings and among populations who might be left out from regular vaccination campaigns. We need to make the same progress in treatments and clinical trials. The EU and its member states, as Team Europe, have stepped up by contributing to the ACT accelerator and joined the COVAX facility to promote equitable and affordable access to COVID-19 tools and immunization against COVID-19 as a good global public good. Mr. President, an effective, transparent and science-based investigation on the origin of the SARS-CoV-2 is paramount and can provide us with clues to respond to this and prevent future pandemics. Understanding that this endeavor may not be concluded immediately, we look forward to regular in-depth updates on the progress of the investigation. We reiterate our support for the work of the independent panel, IHR Review Committee and IOAC. We look forward to their recommendations to be considered in an inclusive progress involving all member states in developing a resolution on strengthening WHO and global preparedness facilitated by the EU. The pandemic has made clear once again that urgent need to invest in and create resilient health systems. With the goal of universal health coverage and other health SDGs, we express concern about the growing gaps, inequities and worsened health outcomes during the past year, particularly in sexual and reproductive health and NCDs, including cardiovascular diseases, cancers, diabetes, and mental health conditions. To contribute to enhance global health security, the EU has taken action towards building a European health union. We will improve EU's health security framework, reinforce crisis preparedness, strengthen the ECDC and EMA, and consider the establishment of an EU Health Emergency Preparedness and Response Authority. We will work together in close collaboration with WHO and regional office. Today, we're all facing the same challenge. The EU and its member states will continue to be a driving force for multilateralism in addressing them and learn our lesson to be better prepared. Thank you very much, Mr. President.
Thank you, Austria. And Finland, you have the floor.
General colleagues, Finland aligns herself with a statement by the EU and its member states. We thank the Director General for his comprehensive report. The past 12 months have been the greatest challenge of our generation. The lives lost, the human suffering, and the economic losses cannot be retrieved, but we can do better going forward. Finland strongly believes that health and the economy are interlinked, and it is possible to protect both. We welcome the appointment of the Council on the Economics of Health for All, of which Prime Minister Sanna Marin will act as the patron, and look forward to its work, analyses, and recommendations. We also welcome the Pan-European Commission on Health and Sustainable Development, to which President Tarja Halonen brings her expertise. Scientific, strategic, political, and moral leadership have never been so critical in guiding the global community and individual countries through this crisis. While the pandemic is by no means over and significant efforts are required to control it, we have already started to look to the future to see how we might become better prepared and more adept in our response. Considering the lessons learned is a must. At the same time, we should not fall into the trap of predicting the future based on the latest experience. We can never know what the next crisis may be. We must be prepared for anything. The good news is that by taking an all-hazards approach and working together across different sectors and at all levels, including through multilateralism, we can take precautions for any eventualities. To strike the right balance between health and the economy in a sustainable manner, we must start investing more in preparedness at country level and globally. By building back better and by supporting people's health and well-being, we can mitigate the long-term impact of the pandemic and help restore progress on the Sustainable Development Goals. Thank you.
Thank you, Finland. And now to Kenya, to be followed by the United Kingdom. Thank you.
Thank you, Chairperson. Kenya aligns with a statement delivered by Burkina Faso on behalf of the African member states. Kenya thanks the Director General for his report and takes this opportunity to commend the DG and the entire WHO Secretariat for their commitment in coordinating the global public health response to the COVID-19 pandemic. Like most countries, Kenya is coordinating a national response to the COVID-19 outbreak, and we are grateful that the actions of our population in following the recommended public health measures have borne fruit, with Kenya now recording fewer number of cases and deaths for the past few weeks. Chairperson, Kenya welcomes the recent emergency use authorization by WHO on some COVID-19 vaccines and takes note of the disproportionate rollout of COVID-19 vaccines across the world. Given the catastrophic impact that the virus has had on our lives and livelihoods so far, coupled with emerging threats of new variant strains, Kenya calls for WHO, member states, and all international actors to work together to guarantee fair and equitable access to available COVID-19 vaccines. We regret to note that history is repeating itself yet again and calls for global solidarity, going silent over vaccine delivery and distribution to low and middle-income countries. As a member of the COVAX Facility Advanced Market Commitment, Kenya continues to support calls for vaccine manufacturers to swiftly facilitate the transfer of the required technology and know-how to other manufacturers so as to end the acute phase of the pandemic. Through the relevant UN organs, we also support initiatives aimed at easing intellectual property rights, which pose barriers to access to affordable medicines and vaccines for vulnerable people around the world. In conclusion, Chairperson, Kenya welcomes the preparation of the WHO program budget and takes note of the proposed 4 key strategic themes. We request the Secretariat to maintain the GPW13 focus on equity and progress towards universal health coverage as we accommodate the emerging priorities brought on by the COVID-19 pandemic. We stand ready to support the process and request the Director General to ensure that the needs of the most vulnerable are factored into the next budget. I thank you.
Thank you very much, Kenya. And now to the United Kingdom, to be followed by Romania.
Thank you to WHO for your continued hard work in coordinating the world's health response to COVID-19. No one is safe until everyone is safe, and the health of every country depends on the whole world having access to safe and effective vaccines, therapeutics, and diagnostics. The UK is committed to rapid, equitable access the UK is committed to rapid, equitable access to safe and effective vaccines, treatments, and tests through multilateral collaboration. We are pleased, as well as being a top donor to WHO, to have helped raise $1 billion for the coronavirus COVAX AMC through match funding other donors, which combined with the 548 million of UK aid pledged will help distribute 1 billion doses of coronavirus vaccines to 92 developing countries this year. However, with new variants emerging around the world, it is essential that the international community is on the front foot and quickly enhances genome surveillance and reporting. We look to the WHO for leadership on this, and the UK stands ready to support. COVID-19 has highlighted the inequalities within and between nations and is reinforcing and exacerbating them, further risking the delivery of the Sustainable Development Goals. Continued collaborative effort will be required to tackle these inequalities, strengthening health systems and halting the backward slides in progress made against global health outcomes in recent years. It is important that the 148th Executive Board has met not just to discuss and make decisions on issues directly related to COVID-19, but also on a range of other important health topics, including AMR, patient safety, HIV, NCDs and disability. Yesterday, our Prime Minister officially launched the UK G7 presidency. We are pleased that this will include a health track. This will continue a focus on the response to the challenges of the ongoing health crisis, whilst looking ahead to how we can do better for the future. And the UK will continue to look at how we can globally build back better as we host COP26 in the autumn. Climate change continues to be an important global health issue. The public health motives for action are based on strong and compelling science, and health systems are key to mitigating the health impacts of climate change, whilst they themselves are vulnerable to its impacts. It has been a challenging 12 months for us all, but I'd like to finish by expressing our profound gratitude to health and social care workers and scientists around the world who've been working tirelessly to save as many lives as possible. Thank you.
Thank you very much. Romania, you have the floor, to be followed by Israel.
Thank you very much. Mr. President, Director General, Excellencies, Romania fully aligns itself with the UN and its member state statement. We would like to thank the General Director for the comprehensive report presented. Romania highly appreciates the continuous efforts of the World Health Organization as the leader of the international public health architecture and believes that the UN system must be central to our global action. The COVID-19 pandemic has shown once again that global challenges require common action, solidarity, and cooperation. Romania values the essential role of WHO in the fight against COVID-19, supporting member states in the implementation of their health policies, strengthening effective health system, mobilizing the international community for the development of the new diagnostics, therapeutics, vaccine, but also putting in place the instruments for equitable access to them. Our debates take place almost 1 year after the outbreak of this pandemic. The current global situation remains dire as many healthcare systems are overstretched and need to find adequate answers. There are reasons for hope given by recent evolution in the vaccine development, production and distribution, and by the beginning of the immunization campaigns. Ensuring equitable access to COVID-19 vaccine is essential, and WHO role is crucial to avoid discrimination between countries and people. We have all faced new, complex and difficult situations in the past year due to the pandemic and also to the need to continue ensuring the necessary health services for our pandemic and for our population. It is of utmost importance to use in a most efficient and pragmatic way the experience we have accumulated and the lesson provided in order to consolidate and to adapt our health system for future pandemics or other public health global emergencies. This has to take place in an articulated manner at national, regional, and international level, with WHO having an active participation to this process. We need to continue our debate on different proposals of strengthening the WHO pandemic preparedness advanced by the member states. We need to use also the conclusion and recommendation of the reports from the Independent Panel for Pandemic Preparedness and Review, the Review Committee of the International Health Regulation, and the Independent Oversight and Advisory Committee of WHO Health Emergency Program for consolidation of our organization. Thank you very much.
Thank you. And now to Israel, to be followed by Germany.
Thank you, Chair. Director General, Member States, Excellencies. 1 year ago, the world as we know it changed forever. Now more than ever in the history of public health, coordination, cooperation and collaboration have been vital in minimizing the damage to health systems, economies, and of course the individuals affected by this outbreak. First, we must stop and acknowledge all the frontline workers, from EMTs, paramedics, pharmacists, nurses, and doctors, to cleaners, orderlies, caregivers, social workers, drivers, IT and security personnel, and everyone else whose work has been an integral in dealing with this pandemic. During the last year, the State of Israel has been grateful for the work we have done with the WHO in dealing with the COVID-19 pandemic. When countries share data and best practices, we ensure that professional advisory organizations such as the WHO have the tools and the experts need most to help guide our health systems in dealing with the pandemic of this scare. The WHO's publishing of hundreds of COVID-19 related guidance materials have been invaluable to Israel and our partners in managing our pandemic response, and the transparent, evidence-based information has been especially important. Going forward, it is important to ensure that we continue to strengthen the systems set up during this pandemic, including early detection, verification, and warning of novel virus strains, and data sharing and reporting mechanisms. The WHO serves as the nucleus of World Health, and the organization must be able to disseminate accurate information worldwide as soon as data is available to ensure maximum efficiency in dealing with any health crisis in the future. We must also remember, when thanks to the efforts of biologists, chemists, genetics, pharmacologists, and doctors worldwide have given us hope that the pandemic must soon be behind us. Even in Israel, where we have vaccinated over 2 million residents, we must not allow pandemic fatigue to negatively impact our decision-making. We are actively sharing the knowledge we gain from this process with WHO and other countries. The WHO has also been integral in ensuring that not only do we not fall into pandemic fatigue, but that we also don't become too pandemic focused. And we must continue working to ensure that all essential health services are supported, even during these tiring times. Lastly, as countries prepare to vaccinating their population, we will again be fighting against misinformation and uncertainty. The WHO will play an important role in advising all countries on managing potential anti-vax movements with positive messages and transparent data-based information campaigns. The end is in sight, and we must continue our important cooperation to get there. Thank you.
Thank you, Israel, and now to Germany, to be followed by Austria.
Can you hear me? Okay.
Yes, thank you very much.
Okay, sorry. Germany aligns itself with the EU statement held by Austria. An unprecedented year for WHO. Every member state and all of us individually lays behind us. And while there are prospects for the end of the pandemic at some stage this year, COVID will remain a key theme for our lives in 2021 and beyond. DG, you've said it clearly. COVID is the greatest crisis of our time. The international structures have proven not to be adequately prepared for a global health crisis of this dimension. Never before the international attention has been so focused on WHO like in this crisis. As we have stated before, COVID has shown the world's expectation vis-à-vis WHO by far outweigh WHO's de facto abilities. There is a serious discrepancy in between our political appraisal for WHO and the common will of 194 member states to finance the needed capacities. To enable WHO to fulfill its ambitious mandate should be one of the key tasks for all member states. Within its limited financial, human, and legal capacities, WHO has played and still does play a crucial role in the ongoing response, and we applaud the DG and all staff for your dedicated commitment through your work for WHO. COVID-19 has the potential to reorder the global health architecture far beyond WHO. In this regard, the Global Action Plan for Healthy Lives and Well-being for All, which brings together 12 key multilateral actors, can and should play a crucial role for coordination and alignment. On the 7th of October, the German government has adopted a new strategy on global health. Its key objective is to contribute to the achievement of the health-related Sustainable Development Goals by 2030. With the strategy, Germany clarifies that we want to strengthen WHO coming out of this crisis. A WHO that is fully equipped to fulfill its mandate as the leading and coordinating authority in global health. Given the lessons learned process, the year 2021 will be decisive and a unique opportunity to align WHO's financing, governance, and mandate in order to ensure its leading role in global health. Germany is fully committed to bold reforms. Only a truly enabled and strengthened WHO can serve as the needed safeguard for global health and health security for all in the future. I thank you.
Thank you very much, Germany. And now to Austria, to be followed by China.
Thank you, Honorable Chair, Director General, members of the Executive Board. Austria aligns itself with a statement made by the European Union and member states, and not to be confused, this is our national statement as a member of the Executive Board, not on behalf of the European Union. Austria thanks the Director General for his report and constant personal engagement in this challenging period of the COVID-19 pandemic. Austria reassures you of its continuous engagement in the multilateral system of securing global health. We appreciate all the valuable work on coordination and information provided by WHO and its tireless staff during the pandemic, while we reaffirm the need for a flexible and prompt handling within the governance structure, in particular in crisis times. And you know also my criticism that the Executive Board as a governing body is not playing its role as it should, and I'm looking forward to have our retreat convened as soon as we can meet again face to face. Dear Dr. Tedros, regarding COVAX facility, I want to direct some questions directly to the management of Gavi COVAX. We are here the Executive Board, the governing body, so I think we need some answers directly from there, because it's not directly you, Director General, who is doing this crucial work. The basic principles of COVAX are a fantastic idea. No questions. Equal access to vaccines are crucial. But I see substantial shortcomings of COVAX to deliver, and it's on its heroic goals. COVAX is slow, has not closed the crucial numbers of contracts, and therefore substantial numbers of vaccines being timely delivered to the member states. So there are questions to be answered. What did the management of Gavi COVAX do to create a transparent and inclusive work process towards reaching its goals? What do I mean? I'm personally the co-chair of the steering board of the procurement group of the 27 EU member states and the European Commission. Since early June, we have been meeting each and every week at least once, if not 3 times, making strategic decisions, putting together a broad portfolio of vaccines. Our joint negotiation team is practically meeting daily. So transparency and inclusiveness is a key for success on delivering our vaccine plans and the procurement processes behind it. I want to state clearly, we did do our homework within the European Union to secure for the needs for our 450 million US citizens to have access to this urgently needing vaccines. We were in the European Union skeptical that Gavi COVAX had the means and the capabilities to fulfill its task to negotiate the necessary contracts and to secure the needs of our citizens. More, the proposals that Gavi negotiated side by side with the European Union, with the producers, was rejected by the management of Gavi COVAX. So I would like to express the clear statement that the European Union and its member states are exercising its global solidarity, and we are the single largest donor when it comes to supporting Gavi COVAX facility. Another crucial question: why and on which grounds did the management of Gavi COVAX decide earlier last year not to include the mRNA vaccines in the portfolio of COVAX? This was a major mistake, taking into account that the mRNAs are the early ones on the market and the golden standards now when it comes to COVID vaccines. what are the detailed delivery plans of Gavi COVAX management? So what numbers of vaccines can member states expect to be delivered? I don't see any clarity on this matter. Dr. Tedros, I personally know about your efforts to secure access to vaccines to all member states around the world. And you are fighting a heroic fight in this question. So I'm not directing my criticisms to the person.
With respect,
I have to state clearly that Gavi COVAX has to do a better job. The glass of delivering is not even half full. Thank you very much, Chair.
thank you very much, Austria. And now to China.
Distinguished Mr. Chair, hello to everybody. The Chinese delegation appreciates the hard work and the fruitful work of the Director General and the Secretariat in the past year. 2020 is an extraordinary year, with COVID-19 pandemic spreading around the world, and countries facing greater challenges in achieving SDGs by 2030. The Chinese government has always put people's safety and health first. President Xi Jinping personally commanded and deployed the COVID-19 prevention and control, and this is still China is still doing so in a constant manner. We are now in winter. China is facing greater pressure of prevention and control. While doing our own prevention and control, we are, as always, supporting the DG and the Secretariat in implementing the COVID-related resolution of WHA 73. After consultation, the WHO International Expert Group on Virus Origin Investigation arrived in Wuhan on January 14. They are following the quarantine regulations and epidemic prevention requirements, showing a high degree of professionalism and dedication. They have had several video exchanges with the Chinese working group, and the two sides will further jointly carry out scientific cooperation in investigating the origin of virus. China supports and has joined the COVAX facility. We shall take concrete actions to support that vaccines should be global public products, and vaccine availability and affordability in developed countries should be enhanced. China calls on the international community to make unremitted efforts to prevent and control the pandemic, safeguard people's health and promote economic and social development, and jointly build a community of common health for mankind. Thank you.
Thank you. And now to Bangladesh, to be followed by the Russian Federation.
Yeah. Thank you so much, Mr. Chairman, Excellencies, ladies and gentlemen. I, on behalf of our Honorable Minister, Minister of Health and Family Welfare, Bangladesh, I am the Secretary Health Service Division in the Ministry of Health and Family Welfare in Bangladesh. I would like to share something about the meeting of Executive Board. Mr. Chair, I thank the Director General for providing us with the updates on WHO's work on some key areas of public health, including the COVID-19 vaccines. Nearly a year into pandemic, we face a human tragedy and a public health, humanitarian and development emergency. We wish to place on record our appreciation to Dr. Tedros and his team for their tireless efforts in fighting this global menace. Also, I would like to mention Mr. DG of WHO. Very recently, you have sent a letter to our Honorable Prime Minister, Sheikh Hasina, appreciating her to face the COVID situation in Bangladesh effectively. And as a resilience country, Bangladesh, in facing a COVID situation rightly and with a very very important steps. So I'd like to convey my thanks and gratitude to Mr. DG, Dr. Tedros. Thank you very much for your appreciation letter to our Honorable Prime Minister. And after a rough year, there is a light at the after a rough year. There is light at the end of the tunnel. We look forward to having the COVID-19 vaccine for most of us in 2021. We highly commend the strenuous efforts made by scientists around the globe in this regard. We thank WHO, Gavi, CP, and other organizations for their active involvement, support, and participation. It is indeed a remarkable achievement to reach this point in just a short time. Mr. Chair, our Honorable Prime Minister has urged the international community to treat the vaccine for the COVID-19 as a global public good and ensure its timely availability to all countries at the same time. Under her leadership, we adopted a whole of the government approach in Bangladesh to respond to the pandemic for the very beginning. Now we are exploring every possible avenue to bring in vaccines. Once it is available, the frontline workers, including the doctors, health workers, and law enforcement members will be vaccinated on a priority basis. In this respect, we particularly thank the COVAX facility for its valuable support. We are also thankful to other friendly countries and our partners from the private sector for their generous contribution and cooperation. Mr. Chair, while we recognize the development of vaccines as a breakthrough, we need new thinking on how to get our economics back on track. Low and middle income countries need greater assistance for strengthening their health system further. The pandemic is a clarion call on investing more in emergency preparedness while reinforcing One Health approach and a stronger WHO. We must pay attention to develop innovative and digital health solutions to better prepare for the future. Indeed, fighting the pandemic is the key to all of us, but we must not shy away from other dominant global health concerns. Today, antimicrobial resistance is a serious political, social, and economic problem.
Just to remind you of the time. Thank you very much.
To conclude, this is a high time to build back better for our people, not just for now, but also for generations to come. We can only achieve this if we remain united in solidarity. Thank you. Joy Bangla, Joy Bangabandhu.
Thank you. And Russian Federation, you have the floor.
Distinguished Director General of the WHO, distinguished Chairperson, I would like to begin my statement with thanks to all the medical workers throughout the world who have been fighting the pandemic, which has been a threat to the entire international community. The events and to work against prevent COVID-19 have allowed us to have a positive development and prevent. We have worked on a number of innovational technical machines to fight COVID-19. The Russian Federation has begun to roll out its vaccine in all regions of the Russian Federation. Since they need special transport, currently we have more than 1 million people that have been vaccinated. We haven't seen any major negative impacts. They are effective vaccines and has allowed us to reliably protect the entire population. Recalling the declaration of the G20, we opened a collaboration effort to ensure access to the vaccine and equitable manufacturing. We would note the key role of the WHO in fighting COVID-19. The organization has been able to operationally and quickly respond to this infection and create a number of different collaboration mechanisms for countries. However, we would underscore the importance of transparency in information and protecting against new diseases. We would recall the high level of economic interdependence of member states. It depends on the development of the vaccine. And we need to make sure the quality and the methods of information and all of the different indicators and the impact of course, the vaccine on the international society. We would like to thank the Euro Bureau of the WHO, and we thank them for the initiative to create a commission. We note the need to strengthen the guidelines. Would you take over, please? We note the duplications in a number of WHO regulations and the coordinating role in fighting the pandemic, as well as the need for an rule regulation regulator. Would you please? We note the work of the IPPR and the Commission. However, the report of the IPPR, which was published this year, requires more work and contains a number of imprecisions. It should be fully aligned with normal standards of the UN agencies to have a review. We'd also recall that according to the last report of the WHO, over the last 10 years, no infectious disease has led to global mortality such as this one. This has demonstrated the need to increase global attention to this issue. We, of course, call for support for global preparedness to pandemics. I thank you very much for your kind attention.
Thank you very much to the Russian Federation. We should now move to statements by those member states not represented on the board. And we would also wish to once again remind those making statements to kindly adhere to the timelines. With that being said, we wish to recognize the distinguished delegate from the Republic of Moldova to be followed by Norway. Thank you.
Thank you. Mr. Chairman, distinguished Director General, dear colleagues, the Republic of Moldova aligned itself with the EU statement, and we welcome Director General's report and take this opportunity to reaffirm our commitment to continue supporting his activity, notably delivering positive results in the fight against COVID-19 and beyond. Likewise, we would like to express appreciations to every stakeholder, wherever individual or collective, who committed to and contributed to discovering effective vaccines, who worked tirelessly to develop efficient tools in fighting the pandemic and provided equitable access to vaccines and other commodities. COVID-19 pandemic has once again highlighted the need for a multi-sectoral approach to strengthen national and global public health security. It has also emphasized the prominence of strong health systems and emergency preparedness, proving the urgency of universal health coverage. At the same time, we share Director General concern on the way the immunization has developed so far, where there is definitely a large room for improvement when it comes to solidarity and equity. In addition, the current crisis clearly indicates the need to further strengthen national capacities for the implementations of the provisions of the international health regulations, based on national context and national assessment of risks and needs, efficient funding and lessons learned from the current pandemic. Republic of Moldova was among the first countries to approve a cross-ministerial plan for the implementation of the regulations, with an effective distribution of responsibility between ministries and departments involved. We would like to echo again Director General's appeal to enhance One Health approaches at all levels, which is essential in combating global health threats. Updating electronic surveillance systems for infectious disease and public health events, as well as introducing IT solutions for data collection and exchange, is crucial in this context. The COVID-19 pandemic demonstrated the importance of developing and delivering resilient and integrated health services to meet the full range of health services needs and provide access to affordable, efficient, effective, and high-quality health care for everyone, particularly vulnerable people. At the same time, we recognize that while governments indisputably undertake a leading role in framing health systems and providing healthcare services, not one stakeholder can fully deliver in the pursuit of universal health coverage. The design, delivery, implementation, and last but not least, financing requires all stakeholders, public, private, and non-profit, to participate in order to consider the full complexity of health systems and provide efficient solutions for different models. Thank you.
Thank you. And now to Norway, to be followed by Sweden.
Director General, ladies and gentlemen. Norway thanks the World Health Organization's continued leadership in dealing that the World Health Organization-led mission gained access to China to pursue the origins of the COVID-19 virus finally started. This is an important development. During pandemics and health emergencies, we look to the World Health Organization for leadership. As member states, we must ensure that the World Health Organization at any time has the tools, the resources, and the authority it needs to fulfill its mandate. Norway is very concerned about ensuring early access globally and hope this can be addressed soon. All member states must step up. Norway has made considerable contributions in order that there is early access to vaccines, diagnostics, and therapeutics. We would encourage others to support the 4 pillars of the Access to COVID-19 Tools Accelerator. Increased support is needed in order to fight the pandemic. We need a thorough discussion and decision on the financing. A broad perspective on sustainable financing through several channels is required. We share the view that the severe imbalance between assessed contributions and voluntary contributions is harmful for the World Health Organization's independence. Norway is supportive of proposal to strengthen sustainable financing for the World Health Organization, including through increased assessed contribution. In the same manner as COVID-19 has tested countries' preparedness and response, COVID-19 has tested the World Health Organization transformation and its ability to deliver results in countries. We are particularly impressed by the way the World Health Emergencies Program has stepped up to the world in a very difficult time for all of us. The importance of improved science and research into non-pharmaceutical interventions to generate evidence has become obvious to all. We believe that the World Health Organization can play a leadership role in strengthening research in this field. We are looking forward to contribute finding ways forward to strengthen the World Health Organization. Thank you.
Thank you. And now to Sweden, to be followed by Japan.
Thank you, Chair. Sweden aligns itself with the statement made on behalf of the EU and its member states, and we thank the DG for the report. This past year has been extraordinary for both the WHO Secretariat and for member states. Our health systems, our crisis preparedness systems, and our societies at large are being pushed to the limit. Our efforts to safeguard universal health coverage, increase protection from health emergencies, and promoting healthier lives are challenged. The work of WHO is important for all of us. And this past year has shown the world the importance of health for all. That's why we need a strong WHO that is fit for purpose, adapted to the needs in countries and underpinned by sustainable finances and strong governance systems. The COVID-19 pandemic has, like never before, illustrated the need for global leadership in health, and Sweden reiterates its strong commitment to the role and leadership of WHO, and we thank you, Dr. Tedros, for your leadership during this difficult period, and we thank the WHO staff for their extremely hard work. The challenges ahead are vast: to curb the spread of infection, ensure equal, equitable, and swift distribution of safe, affordable, and effective vaccines, minimize indirect impacts, to rebuild health systems and reinforce crisis preparedness. We are facing a backlog of unmet health needs as a result of the pandemic, including NCDs, mental health conditions, and SRHR services. These needs must urgently be addressed. It's important to learn from crisis, as well as to manage this. That is why the Swedish government has appointed a Corona Commission to present lessons learned and highlight where improvements can be made. This is also done in several of the expert agencies in Sweden involved in the pandemic response. Sweden would welcome a similar approach from the Secretariat and would be interested to learn how internal work processes in the WHO Secretariat have been affected and if there are lessons to be learned from that. Finally, Sweden reaffirms its support for the work of the independent panel, the IHR Review Committee, and IOAC, and look forward to discussions on how to take the recommendations forward to create more resilient health systems, promote healthier lives, and improve global preparedness for new health emergencies. I thank you all.
Thank you, Sweden. And now to Japan, to be followed by Jamaica.
All of the hard work and the dedication by General Dr. Tedros and the WHO Secretariat at this difficult time of COVID-19. Taking this opportunity, I would like to make a few comments. First, we believe that the strong and resilient health system is essentially needed, underlying the importance of universal health coverage. To achieve this, we need pharmaceuticals, medical devices, human resources, and sustainable health financing. The COVID-19 pandemic reminded us of the renewed importance of resilient, efficient, and agile health systems. In addition, vaccine is a key tool to contain this crisis. Japan decided to join the COVAX facility at the earliest date, which is expected to speed up and scale up global vaccine production and allocation in an equitable manner. Second, as for WHO reform, we think an impartial, independent, and comprehensive evaluation is necessary to review WHO's responses and the country's initial response to the spread of infection. Third, Japan has been focusing on international cooperation in global health, jointly tackling COVID-19 and other emerging infectious diseases. Furthermore, We have been supporting global health agenda, including polio eradication, antimicrobial resistance, and non-communicable diseases, which we are happy to discuss during this executive board. To conclude, I would like to reaffirm our strong commitment to tackle health priorities at the global level and share our willingness to work together with WHO and member states. I thank you.
Thank you, Japan. And now to Jamaica, to be followed by Turkey.
Chair, Jamaica wishes to thank the Director General for his report. We commend the DG and his team for, in particular, efforts related to the equitable distribution of vaccines as a global public good. Jamaica has been positioning itself for the rollout of vaccines on COVID-19. We have established a national COVID-19 commission, which will provide guidance and oversight of our national COVID-19 deployment and vaccination plan. Our efforts have been bolstered by the country's history of managing vaccination and immunization programs, as well as our robust legal and regulatory frameworks relating to health and food and drugs. Jamaica, as a participant in the COVAX facility, wishes to reiterate the importance of multilateralism through procurement and equitable distribution of vaccines and diagnostics to combat the pandemic. We're also hopeful that countries will fulfill their commitments and fully support this multilateral initiative. Jamaica and other countries depend greatly on the success of the facility. Chair, we'd like to take this opportunity to commend the DG for his strong leadership and thrust to maintain the business continuity of the WHO during the COVID-19 pandemic, including on organizations' non-COVID-19 work, pursuant to the 13th General Program of Work. The design of the program budget for 2022 to 2023 in a flexible and sustainable manner to ensure that the WHO is fit for purpose and can effectively support member states. We look forward to the organization's continued support to our national efforts at achieving universal health care and coverage and the sustainable development goals. Thank you, Chair.
Thank you, Jamaica. We appreciate the virtual background. It felt as though you're in the room with us. And now to Turkey, to be followed by France.
Thank you, Chair. We would like to thank Director General for the report. There is an increasing concern in international community that countries with limited sources will have late access to COVID-19 vaccines. We commend the Director General's efforts in pointing out this risk as a threat to global public health, and we support the DG, WHO, and all relevant partners to take necessary steps to avoid inequitable distribution of COVID-19 vaccines. Chair, there is not a single answer to the question of how emergency and outbreak preparedness in the new period should be. Since we are still in the process of assessment and in the acute phase of pandemic, pointing a concrete answer would not be completely realistic. However, the pandemic has presented us an important opportunity to reshape our national, regional, and global policies in light of the lessons learned. We have no doubt that the DG would guide WHO and member states with necessary steps by taking into consideration the reports from IPPR, IHR Review Committee, and IOAC. Chair, we support 5% increase in the proposed program budget as a reflection of budgetary increase in base program segment in all major offices. However, we'd like to learn more about the financing of the emergency operations and appeals, including the projections and change in the donor base. The contributions of donors for the emergencies are used mostly on operations at the country level to enhance the country impact. We would also like to stress upon the importance of transparency regarding expenditures of these funds by country offices. Transparency at the country level is crucial for transparency at organization-wide. We have no doubt that the necessary oversight mechanism will be at use at the country level and that member states will be informed regularly regarding the changing situation of donor base. Thank you.
Thank you. And now to France, to be followed by South Africa.
Je vous remercie.
Merci, Monsieur le Président.
Thank you, Chairman. Chairman, Director General, France would like to associate herself with the statement made on behalf of the European Union. The current health crisis has reminded us more strongly than ever that health is a common good, which requires our determined and continuous commitment. Because global health depends on our ability to meet health challenges together, we need a strong and recognized WHO. In responding to COVID-19, we have together launched the ACT-A initiative with its goal of developing, producing, and making available diagnostics, therapeutics, and vaccines to tackle COVID-19 in an equitable and universal way, and, of course, to provide support to health systems. Thanks to our efforts, vaccination campaigns through the COVAX and ACT-A facilities are going to start. However, we know that vaccines alone are not enough. We must also mobilize to provide therapeutics, diagnostics, and strengthen health systems. COVID-19 has highlighted the need to have reliable information based on science and information that highlights the link between human, animal, and environmental health. We have therefore set up the One Health High-Level Expert Council. I'd like to thank WHO, the FAO, the OIE, and UNEP for their commitment to and cooperation with this important project, which should be got up and running before the WHO in May this year. The current pandemic has confirmed the crucial role played by those in health systems worldwide. They have been devoting themselves with tireless energy to helping to overcome this health crisis since it started, and we should support them in everything they do. In helping to train them, we have set up in Lyon a global health academy, which has already contributed through its classes to enhancing the response to the crisis. It's also been promoting gender equality. With a view to the forthcoming Generation Equality Forum in June this year, France would like, alongside WHO and Women in Global Health, to get countries to commit themselves more strongly to better including women in those structures which make major decisions about health, and to guarantee health professionals, the most of whom are women, safe and decent working conditions. 2020 was a year when we asked ourselves many questions. We hope 2021 will be that when we can answer them and bring an end to the pandemic. Thank you.
Thank you, France. And now to South Africa.
Thank you. Thank you, Chair. South Africa would like to align with the statement presented by Burkina Faso on behalf of the African member states. In our presentation, we would like to underscore 3 brief points. Firstly, we would like to take this opportunity to appreciate the Director General and WHO staff for their efforts in addressing the COVID-19 pandemic, in particular the attention to making a fair, equitable, and attention to fair, equitable, and timely access to vaccines and other COVID-19 tools. And this, of course, particularly for less resourced countries and communities. We strongly support the passionate call made by the Director General in this regard this morning. The general program of work and the decisions to be taken by this executive board are of immense importance. Achieving sustainable financing for the organization cannot be delayed any further. We give strong support to recommendations to strengthen WHO at all 3 levels, in particular at country level and the regions, in order for WHO to fulfill its mandate. Our third point is on support to countries. This is necessary to maximize provision of health services and sustainable health systems, which are necessary to prevent further loss to health gains that have been made over the last decade. Our focus on improving health outcomes through universal health coverage cannot be overemphasized. We also recognize that health systems are the delivery mechanisms for all the COVID-19 tools. And so we believe that we really need to be giving support to countries to be able to fulfill these mandates. I thank you, Chair.
Thank you, South Africa, and thank you to all of those member states who made live interventions. I understand we also have 2 pre-recorded statements. The those being from Poland and Spain. If we may now play those. Thank you very much.
Thank you, Chairman. Chairman, Director General, distinguished ladies and gentlemen, Spain subscribes to the statement delivered on behalf of the European Union and would like to thank the Director General for his statement and his report on WHO's work in the last 12 months. We support the gratitude expressed to the WHO in its work in tackling the global COVID-19 pandemic. We would like to underscore that the global health system needs to be strengthened. It's important we don't forget that, and at the heart of it must be a reformed and stronger WHO. This is recognized inter alia in the declaration called Together for Stronger Multilateralism, set up by Spain and Sweden last year. Our country is committed to WHO. Over the length of 2020, we stepped up our voluntary contributions to the organization and to PAHO by a factor of 7. This should be added to efforts we have made to contribute to EU funds and the ACT Accelerator, of which we are a founding member and a member of its Facilitation Council. We will cooperate with global vaccination programs, supporting instruments such as COVAX and the AMC in order to ensure universal access to diagnostics, therapeutics, and vaccines against COVID-19. There is no doubt that the international fight against SARS-CoV-2 has proven that the international health regulations need to be reformed. It's also confirmed the importance of promoting globally an integrated health system model based on universal health coverage and continuity of assistance at all levels of care. We think this is the best possible moment to demonstrate our intention of not leaving anyone behind. In Spain, we believe that we can emerge stronger from this pandemic. We will do that if we ensure that health is provided to everyone worldwide in an equitable and fair way and covers human, animal, and environmental health from the One Health perspective. Thank you.
Regional directors, colleagues, Poland aligns with the statement of the EU and its member states. To start with, I would like to thank WHO for its ongoing efforts to fight the pandemic and its leading role in the global COVID-19 response. We are also impressed by the effects of joint global efforts to find an effective vaccine against COVID-19. Never before in the history has a vaccine been developed so quickly. This is a proof that only acting together we could overcome the crisis. Countries on all continents have been hit hard by the pandemic. No dimension of the function of the state has remained untouched. It is no different in the case of Poland. However, current situation can be described as stable. Thanks to the joint effort of the whole society with great dedication of medical staff, the basic safety of citizens is ensured. Nevertheless, threats remain real, thus national services are still on the highest alert. We are convinced that the only way to end the pandemic is mass and rapid vaccination. We call on the international community to ensure that vaccines are available for everyone. By the end of December, Poland has started its COVID-19 vaccination program. Despite many challenges, we can say that the whole process is well organized and goes smoothly. In addition to the logistical challenges, including the availability of adequate number of vaccines in a short time, we also recognize refusal to vaccinate as a potential threat in overcoming the pandemic. While there have been positive trends recently, the problem remains significant. But we know that this problem is faced not only by Poland. We would gladly welcome joint approach to this issue. Honorable Director General, colleagues, a year ago, no one expected that a new virus will so strongly affect our lives. A year ago, no one expected that the world will respond to this challenge so successfully. We cannot celebrate yet. The fight is not over. We must keep acting together in a spirit of solidarity and trust, as it is the only key to an ultimate victory. I thank you.
Thank you very much. And now back to His Excellency, Mr. Chair.
Thank you, Secretariat. I would now like to give the floor back to Director General Dr. Tedros to respond. Dr. Tedros, you can have the floor, please.
Yeah, thank you. Thank you so much, Your Excellency. I think the inputs from member states are very important, and most of them are with recommendations and feedback. And we have taken note of the feedback, the inputs and recommendations. So we will move accordingly. Thank you also for your, many of you for appreciating our staff. As you rightly said, they have been working very hard the whole year, and of course under a very stressful situation. And thank you for that recognition. And I assure you that we will continue to work harder and will not rest until this pandemic is over. But having said that, if my colleagues, there are some specific issues would like to comment, I would be happy. Yeah? Okay. So thank you very much again, Chair. Thank you.
Thank you, Dr. Tedros. I see no further comments on this item. Let me thank the Director General and the Board for this fruitful discussion. This concludes the Board's consideration of Agenda Item 2. We shall now consider Item 3, Report of the Regional Committees to the Executive Board contained in document EB 148/4. The floor is now open for discussion. I would like to once again request that the Secretariat moderate the discussion on the virtual platform. Secretariat, you have the floor, please.
Thank you, Your Excellency, Mr. Chair. May we kindly remind those wishing to make an intervention to please raise their hand once again in the Zoom platform. I wish to recognize Austria would wish to take the floor. Thank you, Austria. The floor is yours.
Thank you very much, Mr. Chairman. I speak on behalf of the EU and its member states. The candidate countries, the Republic of North Macedonia, Montenegro, and Albania, as well as the Republic of Moldova, aligned themselves with this statement. WHA Resolution 73.1 constituted the first joint response by the WHO's membership to COVID-19. It showed that multilateralism, international cooperation, and solidarity were and are the most adequate answer facing a pandemic. We welcome the progress made by the Secretariat and Member States in the implementation of the resolution. Proactive follow-up remains key to guide our responses, WHO Secretariat and Member States alike. For the global response, equitable access, rapid development, and fair development of COVID-19 vaccines, therapeutics and diagnostics, as well as the strengthening of health systems for their deployment, are essential. In partnership with WHO, the EU has been playing a central role in setting up, funding, and co-hosting ACTA as the central mechanism to achieve these goals. We support the full realization of ACTA, including its vaccines pillar, COVAX, which we support both via the AMC and as a self-financing participant, so that all who need COVID-19 vaccines have access to them. To ensure ACTA success, we encourage support of all member states and stakeholders. We also need to address the funding gap, as well as the gap in vaccination between countries. Vaccine donations are also to play a key role. The EU will continue to be a reliable partner and champion for resilient health systems and universal health coverage. The One Health approach at all levels and the objectives of the Global Action Plan for Healthy Lives and Well-being for All to reach the SDGs and to strengthen cooperation among health actors. Mr. Chairman, WHO is an evidence and science-based organization for global health. In this spirit, The resolution asks for an investigation of the source of the virus. Understanding the origin will enable us to better control and respond to this pandemic and future health threats. We welcome that the international expert team was finally allowed to travel to China to start their investigation in cooperation with Chinese counterparts. We attach great importance to this investigation, which requires transparency, access to locations and data, and full cooperation, and we request to be regularly briefed on the progress. Given the danger posed by emerging mutations of the virus, we understand the importance of sharing of genetic sequence data. We thank the UK, South Africa, and other countries for sharing insights and data quickly, and welcome WHO's increased efforts to expand scientific cooperation. 2020 was a year of doom. We all hope that 2021 will be a year of hope. However, the pandemic is far from over. We all must continue working hard nationally, regionally, and globally through multilateral cooperation, trust, and solidarity. With the help of the evaluation processes currently underway, we also need to learn from our mistakes and make bold moves to better prepare for and respond to future pandemics, even whilst combating and recovering from the current one. Thank you very much, Mr. President.
Ambassador, thank you for that intervention. I believe you were actually intervening under item 14.1. The topic we are now discussing is item 3, report of the regional committees of the Executive Board. So if in fact you were intending to make an intervention on item 14.1, I would ask that potentially you would revisit that intervention when we open item 14.1. With that, thank you. I'd like to hand the floor back to the moderator for interventions on the report of the regional committees to the Executive Board, item 3.
Thank you, Dr. Armstrong. I would wish to recognize the United States of America. USA, you have the floor.
The United States notes the committees and wishes to highlight the contributions of the Pan American Health Organization, PAHO, and the Western Pacific Regional Office, where the United States participates as a member state. We were very pleased to sponsor the PAHO governance reform that is mentioned in the report and commend our fellow PAHO members in adopting this reform measure unanimously. We would also like to thank Canada, Brazil, and Mexico for their leadership during the Executive Committee and the Directing Council. The United States appreciates the leadership of Dr. Etienne and Deputy Director Valdez and our close and collegial relationship. Their leadership in the midst of the pandemic has been exemplary. Going forward, the Americas, so hard hit by the pandemic, must work shoulder to shoulder to improve global health in our hemisphere and at the same time rebuild our economies. We are confident that the countries of the Americas will come back stronger than ever and hopefully more united. We look to PAHO to take its rightful leadership role on public health issues in the Americas. And in the Western Pacific, we hope to learn from our friends and partners how they were able to largely contain SARS-CoV-2. Thank you very much.
Thank you very much to the United States of America. We might just give it a very brief moment to see whether there might be any further member states who would wish to make a statement under agenda item 3. I understand that Portugal would wish to take the floor. Thank you. And Portugal, you have the floor. Portugal, it seems that we're unable to hear you at this time. I would just ask that you double check the sound. We will do the same. Thank you.
Like this? Hello, can you hear me now?
Confirm you can. Thank you very much, Portugal.
Thank you very much. Apologies. So, Mr. Chair, Director General, Excellencies, Portugal endorses the report of the regional committees and praises the important role that WHO plays through their regional offices, particularly in implementing, supporting, and advancing health policies and country-level priorities. We commend the new and timely program of work of WHO Europe, stressing its 3 core priorities, which we also take as our own. We highlight the importance of moving towards universal health coverage. While this translates directly into our national service, cornerstone of social inclusion and the guarantee of universal health care in which access and equity are safeguarded. Mr. Chair, the COVID-19 pandemic has come into the global public health agenda as few health issues have done before. We highlight the progressive efforts of WHO in preparedness of countries, strengthening their capacities and ensuring coordinated and effective support when faced with cross-border health threats. We expect these threats to be more and more frequent. We emphasize the future role played by the EU in strengthening regional preparedness, synergistically with WHO, as well as the relevance of the International Treaty on Pandemics proposed by the European Council. These actions will be crucial in order to face future health emergencies anchored in international mobilization and solidarity, allowing us to better anticipate, prepare for, and respond to future pandemics. A stronger and better prepared EU means also a stronger world, and we are all in the same battle against the same common enemy. Thank you.
Thank you very much, Portugal. And now to Guinea-Bissau. Sorry, Guinea-Bissau, I'm just wishing to confirm that you would still wish to take the floor under agenda item 3. It seems not to be the case. As we have no further hands up from member states, we would suggest through His Excellency, through Mr. Chair, that we would give the floor to the WHO regional directors. I understand that the regional director for Southeast Asia, Dr. Poonam Singh, would wish to take the floor. The floor is yours. Thank you very much.
Chair, Excellencies, Director General, the 73rd session of the WHO Regional Committee for Southeast Asia was held on 9-10 September last year, with Thailand as the host. It was chaired by His Excellency, Mr. Anatun Chanvirakul, Deputy Prime Minister and Minister of Public Health, Royal Thai Government. There was a ministerial roundtable which was held on COVID-19, and it comprised of 2 sub-items: country experiences and lessons learned with future transition to the new normal, and the second on maintaining essential health services and public health programs in the context of COVID-19. The committee adopted a resolution endorsing a ministerial declaration on collective response to COVID-19. The declaration highlights member states' commitment to maintain essential health services while building on the region's many strengths in responding to the pandemic. It calls for securing the occupational safety of health workers, strengthening health information systems, and the uptake of digital health technologies, and advancing health policy and systems research on COVID-19. The midterm review of the Decade for Health Workforce Strengthening in the Southeast Asia region was discussed, which highlights the region's progress on human resources for health, and a report on improving retention of health workers in rural and remote areas. Case studies from 6 countries of WHO Southeast Asia region highlighting good practices on successful rural retention policies were presented. An annual report on monitoring progress on UHC and health-related SDGs, and a publication on monitoring progress on universal health coverage and the health-related sustainable development goals in the Southeast Asia region was launched. the committee reiterated the importance of achieving UHC and of making tangible progress towards achieving SDG 3 and the GPW 13 triple billion targets, even in the ongoing COVID-19 response and recovery. On the WHO transformation, the committee noted the draft report on transforming for enhanced country impact, as well as the report from the Director General titled WHO Transformation and Overview. In the discussions that followed, the region's progress on the transformation agenda, particularly in relation to the region's flagship programs, was discussed. As part of WHO's transformation agenda, an accelerating implementation of Pillar 2 of GPW 13 on an innovative mechanism like CRF was appreciated by the member states. This financing mechanism for preparedness and response and its linkages with health system strengthening will go a long way in building community resilience. It is noteworthy, by the end of 2018-19 biennium, 80% of all resources in the region were being allocated to the country level, an increase from 70% from 2014-15. All countries of the region have carried out a country program and administrative review, and more than half have aligned their country cooperation strategies with GPW 13. The region has achieved zero overdue DI reports, and just 1% of all donor reports have been overdue. Region and country office programs are now aligned with the GPW, as are the regional office budget centers. Notably, the Regional Committee adopted a decision on the Global Patient Safety Action Plan, requesting that regional actions be prioritized in keeping with the Global Action Plan, the regional strategy, and country context. Discussing the program budget 2020-21 implementation, the committee observed the need to regain momentum to implement the planned activities in 2021 work plans while continuing with the COVID-19 response. I would like to mention here that though the development of program budget 22-23 was not discussed in RC 73, a regional consultation on the proposed program budget was held on 9th December 2020 as part of the inclusive, consultative, and joint bottom-up planning process traditionally followed in the region. I hereby thank all member states in the region for contributing to a very productive, active, and engaging 73rd session of the WHO Regional Committee. My thanks to the Director General, Dr. Tedros, for sharing his thoughts on several strategic issues. Before concluding, I take this opportunity to thank member states for their keen participation in a series of key meetings that were convened by the regional office in recent weeks on the deployment and vaccine preparedness. Immunization stakeholders from across the region can rely on WHO's steadfast support as together we strive to equitably and efficiently deploy COVID-19 vaccines to promote health, keep people safe, and serve the vulnerable in these very challenging times. I thank you, Chair.
Thank you very much, Dr. Singh, Regional Director for the Southeast Asia Regional Office. Just before we do move to the next regional director, who would be regional director from Europe, we understand that one of our EB members, Guinea-Bissau, would wish to take the floor. If we may suggest that they would do so now. Thank you very much. And Guinea-Bissau, you have the floor.
President. La République de Guinée-Bissau, l'honneur de cette déclaration.
Good afternoon. Guinea-Bissau is making this statement, and it's a great honor for us to do so.
Guinea-Bissau, just wishing to confirm that you can still hear us. It seems we're having a connection issue again.
Okay. Donc, Monsieur le Président, Guinée-Bissau.
As I was saying, Chair, it's an honor for us to make this declaration. We're speaking on behalf of the 47 member states of the African region of WHO. Member states of our region very much commend the work that has been done by regional committees, and we would like in particular to express our deep thanks to the chairs of the regional committees for all that they have done. We have taken due account of the difficult and different circumstances in which regional committees were held last year. We know that there was a very particular set of circumstances, and we would like to thank all of those who worked together to ensure the smooth running of governance mechanisms at all levels of WHO. Consultations were undertaken with a view to developing the WHO's forthcoming program and budget. And here again, we have to think about the context in which we have had to work. We would very much encourage the Secretariat to continue to consult broadly with member states on the program and budget in order to achieve consensus on this as quickly as possible. And we do think that is particularly important as we move towards the forthcoming WHA. We know that a lot of work has been done in seeking to develop global programs of action. And that again is something else that we very much support and we wish to applaud. At WHO as global, at the WHA, we know that some very important resolutions will have to be adopted. And I would like to highlight that for Africa, we really saw some historic developments in our region. We really are able now to look to the future with much greater serenity, thanks to what we have achieved at regional level. And we think that our input to the forthcoming WHO can only benefit from that. We do, however, wish to emphasize the need to work in particular on certain further vaccines and other kinds of medication that can allow us to ensure that polio eradication is something that we can continue to be proud of in our region in the future. And we know that we are in a much better state than was the case recently, but we still need to consolidate what we have achieved. I would also like to highlight the fact that we were able to have in Africa the first kind of regional health summit that we have ever seen that gave rise to a strategy that gives us a clear pathway forward in seeking to strengthen our healthcare services and ensure that they are better tailored to meet the needs of the African region. We think that at our regional committee level, we were able to adopt a number of very important documents, especially on country presence, that will allow us to guarantee universal health coverage throughout Africa. This is something else that we can be very proud of. We think we have again taken a significant step forward, and we now look to country offices throughout Africa to ensure that we can create the synergies we need and use the comparative advantage that we have in order to guarantee UHC for our continent. We were able, at the regional committee, also to adopt a report on healthcare systems. And this report lists the various levels of capacity that we have in order to ensure that we can have
a high-performance healthcare system throughout our continent, taking into account the needs and the particular features of every country within the region. We need to ensure that we can all move forward together to achieve this common goal. Now, we recognize that that is an important starting point to allow us to achieve the SDGs, particularly those that are related to health in the near future. Thank you.
Thank you very much, Guinea-Bissau, and pleased that we were able to connect with you. Once again, apologies for the technical issues. May we suggest now that we would return to the Secretariat's responses to Agenda Item 3, those being from our regional directors. We understand that the Regional Director for Europe, Dr. Hans Klug, would wish to take the floor. Thank you, and the floor is yours.
Thank you very much, Chairperson, distinguished board member and delegates. It's my great pleasure to briefly inform you about the work of the 17th Region Committee convened 13 to 15 September last year, virtually, with the adoption of special rules and procedures under the auspices of its chairperson, Dr. Alexei Vladimirovich Tsoi, the Minister for Health of Kazakhstan. Encouraged by calls from member states, we introduced a paradigm shift in the format, the culture, and the substance of the Regional Committee, reducing the format to 2.5 days and organizing the sessions according to 3 dimensions. The first day focused on the political dimension, the second on the technical, and the third on governance, transformation and financing. I would like to thank our then SERC Chair, Dr. Søren Brøstrøm from Denmark, and all SERC members for supporting this innovation. I'm also very grateful to all the 5 regional directors who were sharing with me how they successfully implemented such a paradigm shift to attract maximum ministerial presence. We successfully ushered in a new culture of free, frank and friendly exchange and discussion with the member states, providing a platform on which to tailor the Regional Committee further as we look towards our 71st session this September. The Regional Director's report was delivered in a TED Talk format, where I laid out the foundations for the future beyond COVID-19 and reflected on the COVID-19 response by the Regional Office through 3 main axes we set ourselves. The first one, keep direct contact with every single country of the 53 member states for a more targeted response. Second, strengthen partnerships with other organizations working in the region. And third, to restructure the Regional Office to be fit for purpose. We had keynote addresses from our patron, Her Royal Highness the Crown Princess of Denmark, as well as from Her Highness Queen Mathilde of the Belgians, the EU Commissioner for Health, Dr. Stella Kyriakides, and Professor Mario Monti, who highlighted some very important issues on our agenda, such as the inauguration of the Pan-European Commission on Health and Sustainable Development to rethink policy priorities in the light of pandemics, the role of the health workforce during the pandemic, the importance of mental health and our plans to launch a mental health coalition, the need for closer coordination and partnership among international organizations, and the longer-term implications of COVID-19 for health and social care systems in Europe. We had an overwhelming support from the member states for the approval of the European Programme of Work 2020-2025, United Action for Better Health in Europe, a year ahead of what was originally planned. The EPW aligns the regional actions and priorities with the global strategic priorities of GPW 13, also placing people squarely at the center by drawing on the legitimate expectations of citizens vis-à-vis their health authorities. Member states also endorsed the 4 new flagship initiatives on mental health, digital health, immunization 2030, and behavioral and cultural insights, and appreciated that the EPW reflects the impact and early lessons learned from the pandemic, not losing sight of the continuity of essential health challenges and services, fully subscribing to the WHO transformation process. Finally, let me reiterate my great appreciation to the chairperson, Dr. Alexei Tsoy from Kazakhstan, who in heart and mind was close to us, but in distance far away, and virtually did a fantastic job, as well as the other officers of the Regional Committee who helped and supported us tremendously to making the 70th session of the Regional Committee for Europe a truly historical one. Thank you for your attention.
Thank you very much. And now to the Regional Director for the Americas. Dr. Etienne, confirming that you have the floor. Thank you. It would seem that we are unable to connect you at this time. If I may suggest that we would move to the Emira region. We understand that Dr. Jafar Hussein would be taking the floor. Thank you very much. And Dr. Hussein, the floor is yours.
Thank you so much. Thank you. I was muted actually by the Secretariat. Mr. Chair, Director General, Your Excellencies, I have the privilege and honor to present the brief report on the 67th session of the Regional Committee on behalf of the Regional Director, Dr. Al-Mandari. The session was chaired by Her Excellency, the Minister of Health of Egypt, Dr. Hala Zayed. She was physically present in Emro, but the session was otherwise a virtual session. All other 21 member states were connected virtually. The regional committee was for 2 days, 12th to 13th of October, as decided by the program subcommittee before the actual happening of the regional committee. In the inaugural session, after the session was inaugurated by Her Excellency, the Minister of Health of Egypt, a keynote speech was presented by Her Royal Highness, Princess Muna, on the health workers, midwives, and nursing and their role in the COVID-19 pandemic. The session took into account various important global and regional health agenda items. The committee considered several reports relating to the impact of COVID-19 pandemic in the region. It was noted that despite a proactive response in the region, the pandemic was having an alarming impact, including serious disruption to essential health services. The member states called for further action to tackle the pandemic and maintain essential health services, and endorsed a new regional strategic framework on emerging and epidemic-prone infectious diseases. It was noted that the pandemic had also highlighted concern about access to medicine and vaccines in the region, particularly in countries in complex emergencies in the Eastern Mediterranean region. And in response, the committee endorsed a landmark new regional strategy to improve such access. The committee agreed to establish a new regional subcommittee on polio eradication, noting that EMR is the only region where polio is still endemic, to ensure high-level oversight of this vital work. Several member states during the regional committee expressed strong interest in joining the subcommittee on polio eradication and outbreaks. In several other resolutions, the committee approved a new procedure for accrediting regional non-state actors not in official relation with WHO to attend its meetings, and endorsed a strategic action framework to improve access to assistive technology. Several items of business, including the proposed approach to develop a new program budget, the draft Global Patient Safety Action Plan, and the Global and Regional Report on Transformation, were presented as documents, but were not discussed during the paucity of time. Finally, on behalf of the Regional Director, I would like to extend gratitude to all the honorable ministers of the 22 member states to have shown solidarity and collegiality during this very painful time of the pandemic, where many member states came forward to support those member states who required the much needed support. I thank you, Mr. Chair, Director General, and honorable colleagues, and over to you, Secretary. Thank you.
Thank you very much, Dr. Hussain of EMRO, and to the regional directors of CIARO and Euro for their statements. We understand that the regional director of the Americas would wish to come in. If we may try once more to connect with you. Thank you very much. And Dr. Etienne, you have the floor. It seems we're still having some connection issues there. With that being said, I would hand back to His Excellency, to Mr. Chair. Thank you very much.
Thank you, Secretariat. As I see no more comments now, I take it that the board wishes to take note of the report. I see no objection. The report is noted. This concludes the board's consideration of item 3. Excellencies and distinguished delegates, it is now 1:10 p.m. Central European Time and time for taking the scheduled 1-hour break. We will reconvene at 2:10 p.m. Central European Time and resume our discussions. Thank you. Welcome back after the break. I hope you all had a very refreshing break. We shall now consider sub-item 14.1, COVID-19 response. The report by the Director General is contained in the document EB 148/16. The board is invited to note the report. Before I open the floor for discussion, I would like to give the floor to the Secretariat to provide a technical update. Secretariat, you please have the floor.
Thank you very much, Chair. Let me begin. I'm just bringing up a slide that this afternoon both myself and Dr. Brusair will provide you with updates on the operational and technical response to COVID-19 and on the ACT Accelerator. Slide. There we go. Ooh. The double trouble. Okay, I need to be more patient. Your Excellencies and colleagues, following 2 weeks of low reporting at the end of 2020, likely due to the holiday period, an overall upward trend seen in earlier weeks has resumed, with just under 5 million cases reported last week globally. The number of deaths has also shown a similar trend, with over 93,000 deaths reported last week. We are likely to reach 100,000 deaths reported per week very soon, and we have just exceeded 2 million deaths overall, and now over 93 million cases. In the Americas, in the last week, 87% of all COVID cases and 87% of all COVID deaths have occurred in the Americas and in Europe, with the other 4 regions represented 13% of all cases and deaths. Over the last few weeks, the number of cases continues to grow in the Americas, the Western Pacific and Africa, while overall numbers have stabilized or are declining in Euro, Emerald and Sierra. However, trends within regions vary widely. In the Americas, we are now approaching 1 million deaths, with this region, within this region, accounting for 53% and 47% of all cases of deaths globally in the last week. Many countries in North, Central and South America are experiencing increases in cases and deaths. In the European region, numbers are stabilizing but remain very high in terms of cases and deaths. In Southeast Asia, the decline in new cases and new deaths seen since the end of November 2020 continues. However, this reflects mainly the trends in India, Thailand, Nepal and Myanmar, with cases rising in Indonesia, Sri Lanka and the Maldives. The Eastern Mediterranean accounts for 3.9% and 3% respectively of cases and deaths globally in the last week. Trends are downwards or stable in many countries, with increasing trends in Lebanon, UAE and Tunisia. Lebanon has experienced a doubling of deaths per million population in the last week. Trends in the African region demonstrate large percentage increases in cases and deaths across countries in many sub-regions. The percentage increases in deaths per million are very large in a number of countries and may signal larger numbers of undetected cases at community level. The Western Pacific continues to report a higher number of cases and deaths, albeit from a much lower baseline. 5 countries represent 98.7% of all cases in the region in the last week. That is Japan, Malaysia, Philippines, the Republic of Korea, and China. However, overall, Wipro only contributed 1.7% of new cases and 1.2% of new deaths globally in the last week. There is a male preponderance in deaths despite a higher proportion of older population being female. 75% of all cases reported were between the ages of 15 to 64, but 83.4% of deaths were in the over 65s. However, it is important to note that 16% of all deaths were amongst those 25 to 64 years old. This slide illustrates that high preponderance of cases in the 15 to 64-year-olds, but the large representation of deaths in those 65 and over. Infection fatality rate is an estimate of the percentage of people infected who die and is usually much lower than case fatality rates, which is directly calculated from confirmed cases and deaths. In this graph, you can see that infection fatality rates have increased progressively with age in this pandemic. Case fatality is also calculated as deaths as a proportion of reported cases. This has increased dramatically with age, and it exceeds 10% in those 65 years and over. Additionally, other risk factors for mortality and comorbidities and underlying conditions have an odds ratio for death estimated between 1.5 and 2.25 for a range of conditions, and this is from a review of studies just published, but does not represent the totality of the estimates. There are many different estimates. Safe to say that underlying morbidity and pre-existing conditions have a significant impact on mortality. However, the bottom line is that population mortality related to COVID increases with COVID incidence. This graph shows you just simply how the total number of cases per million drives your total number of deaths. In other words, the more cases you have overall, the higher the mortality impact in your population. So in that sense, the previous strategies of herd immunity by mass infection rather than mass vaccination it shows that high incidence leads to high mortality, and letting this virus rip at community level causes a much higher mortality. Health worker infections. Health workers have been badly impacted during this pandemic. From WHO's case database, which represents 33 million records, health workers represented 7.7% of all cases. However, the percentage overall of health workers affected by country over time is different in different countries, and in many reviews of the literature, health worker infections can account for up to 35% of cases in some countries. What's good to note is that is a downward trend in terms of the number of cases in healthcare workers. I want to just give you a very brief overview on SARS-CoV-2 variants, because I think this is an issue of great concern for you all. It is well known that the viruses constantly change, and they replicate, and the variants are produced that may be more fit, and these are selected just as part of virus evolution. As such, the emergence of new variants is an expected occurrence. And while the majority of mutations have no impact on the virus or could even be detrimental, few may provide the virus with an advantage. You will have seen and witnessed with us the 5 specific events that WHO has been tracking, and these occurred over the last year. The first was the replacement of a circulating D614 virus with a G614 virus, and very successfully replaced the circulating strain on a global basis, but was not associated with any increased clinical severity. Again, we have seen between August and September a mink-associated SARS-CoV variant emerge in Denmark. SARS-CoV-2 variant of concern be detected in the United Kingdom, and then on the 18th of December, a SARS-CoV-2 501Y-V2 reported by South African authorities. And most recently, a SARS-CoV-2 P1 lineage, which was reported in Brazil, was originally detected in Japan, where it was called, I believe, Maria, the B118 variant. I'll speak a little bit about all of these variants and how they're named in a minute. Okay, this slide just shows you how the G614 variant spread and successfully replaced the previously circulating variant over time. The mink-associated variant in Denmark demonstrated the importance of the animal-human interface in potentially driving virus evolution. The ability for the virus to evolve quickly in high-density small mammal populations was clearly demonstrated, but the efforts by Denmark to contain the variant are to be commended, both on the animal and the human side. The detection of a variant of concern in the UK, first reported on the 14th of December. This, I'm sure most of you have seen this many times in the news, and has been extensively investigated and reported by the authorities in the United Kingdom, and has spread and been detected in over 50 countries, I think 58 countries as of the 17th of January, across 5 regions of WHO. In England, this has been detected in all regions and almost all local health authorities, and they've been using an S-gene target failure in diagnosis on the detection in order to use as a proxy or indicator of carriage of the variant of concern. Again, you'll see here how the variant spread very quickly across the UK, both in terms geographically and in terms of the proportion of cases that were caused by this variant of concern. Those purple, the increasing purple on that top line tells you just how intense and how quick that transformation was. The analysis using contact tracing data has showed higher transmissibility, secondary attack rates, and I believe in other studies, higher viral loads have been confirmed. So this has been the main reason for this virus being of concern. On the 18th of December, South Africa reported a variant 501YV2, And since then, that has been detected in 22 countries and territories, and again on 4 of the WHO's 6 regions. There are some data and modeling to suggest that this virus may be more transmissible, but this variant, and while this variant does not appear to cause more severe illness, the observed rapid increase in cases has put health systems under additional pressure. In addition to that, there has been the government of Japan reported a new lineage of the virus B11248, which was reported in travelers into Japan from Brazil. This has subsequently been called the lineage P1, which has been detected in Brazil, and has a unique constellation of defining mutations, and including several mutations of known biologic importance. And this is being currently investigated for its epidemiologic and clinical impact. Of note, WHO has been working with member states and partners to enhance a robust risk monitoring framework to evaluate SARS-CoV-2 mutations, variants of interest and variants of concern. It's critical that we leverage existing sequencing capacities across SARS-CoV-2 reference laboratory networks, the Global Influenza Surveillance and Response System, and other networks, including polio, academic, private, and commercial sequencing platforms. The Virus Evolution Working Group and the R&D Research Meeting Working Group members agreed that there's a need to come up with a standardized nomenclature for the different variants based on the genetic sequence. We have outlined guidance on setting up enhanced SARS-CoV-2 sequencing, been reaching out to labs with surplus capacities to support countries that do not have those capacities. And our goal is to be more proactive, to create and leverage the networks we have, to extend those networks, and be more proactive in looking for mutations, combinations of mutations, and linking very, very closely surveillance, epidemiologic, and laboratory surveillance systems to ensure that we're chasing mutations and variants of clinical, epidemiologic, and research relevance. You're all aware of WHO's global strategy. The Strategic Preparedness and Response Plan was published on the 4th of February. We're currently reporting out on that now, and you should have by the end of the month a full report on the implementation of the SPRP 2020 on your desks. The core of the strategy was to suppress transmission, protect the vulnerable, save lives, and provide a comprehensive framework for containment of the disease. Okay. We'd like to acknowledge the more than 70 donors throughout 2020 who've provided $1.5 billion to WHO of the $1.7 billion requested, and to confirm that WHO's projected utilization of $1.3 billion of that, and that approximately 90% of funds have been allocated to support operations, the purchase and distribution of essential equipment, and other capacity strengthening activities at country and at regional levels. In addition, the WHO Contingency Fund mechanism also kick-started the whole response for COVID-19 early in January 2020, $10 million contribution. So again, we thank all of those donors who contribute regularly to the Contingency Fund for epidemics. The strategy moving forward for 2021 is essentially the same core strategy based on the pillars that have been previously outlined, and the cross-cutting pillars that support and coordination and planning, operational support, and accelerated research and innovation. Of note, there is the focus that we will have to place on supporting countries in vaccination, led by Kate O'Brien and Sumia internally with Bruce, and bringing the organization together around doing everything possible to deliver on vaccination, both from an operational and readiness perspective at country level. A core part of what we've been doing in WHO, and I'm not going to, but we have lots of extra slides, supplemental slides that we will send to you after, showing all of the activities in the different areas. We do not have time today. But the core of what we're trying to do under your leadership is translating technical knowledge into coordinated action. We have published hundreds and hundreds of documents, but more importantly, I think, we've leveraged evidence and expertise, our expert networks, collaborating centres, our strategic advisory groups, our massive online consultations and meetings, the R&D blueprint for epidemics, the multi-country studies that have been carried out, like Solidarity and Unity. But in translating them into authoritative, accessible guidance, which is rapidly and constantly re-evaluated, and with working in partnership with the Chief Science Officer, we've been working very hard to increase the quality and predictability of those documents. They're multidisciplinary, multilingual, multi-agency. They're adapted to different contexts, and the content is being shared through multiple channels. Driving those guidance down for implementation, we've used digital transformation of knowledge into learning, using innovative training platforms like OpenWHO. We have over 150 country offices in our 6 regional platforms, led by our regional directors and regional and emergency directors, providing tailored operational and technical support to member states. And we have multi-agency operational platforms that surge people and material resources to the field, including the UN Supply Chain Mechanism, the Emergency Medical Teams platform, and the Global Outbreak Alert and Response Network. What I think is unique is that we're pulling information from those country experiences and that implementation through key performance indicators that drive a monitoring and evaluation framework. We have multiple country case studies and reports, which are coordinated by Shambhu and his team, targeted operational research. We monitor the infodemic in terms of both listening and engagement. We have interaction reviews, over 30 of which have been completed and 25 more, and multiple supports to simulation exercises at national level to learn lessons. Importantly, regional consultations led by the regional directors and REDs and engagement with country officers and member states have been crucial in providing the feedback loop, which then again drives how we generate the next layer and the next round of evidence. I've spoken before about the COVID Partners platform, still going strong and providing an integrated platform at country level for planning, funding and implementation. And spoken about the UN Crisis Management Team with its 9 work streams. This is a coordination mechanism that allows all of us in the UN system to work together, to share, to communicate and orient our activities towards country implementation under the leadership of the resident coordinators and the humanitarian coordinators in the field. And looking ahead, just very, very briefly, currently our epidemiologic situation is dynamic and it's uneven. It's further complicated by variants of concern. But however, many countries continue to be able to suppress transmission. Suppression of transmission and control of this virus is possible. Healthcare systems and workers have saved countless lives, but they're under extreme pressure in many countries in terms of capacity, workforce, and supplies. Surveillance systems are finding it hard to cope with the high force of infection in many countries. Case and cluster investigations, contact tracing, and supported quarantine of contacts remain underpowered in almost every country. Communities are suffering and struggling to maintain public health and social measures, as well as suffering loss in social cohesion, education, income, and security. With regards to the epidemic, empowered communities have played a key role in the control of COVID-19. Although misinformation and disinformation continue to undermine the application of evidence-based responses and drive individual behavior, science has delivered on solutions. I'll say that again. Science has delivered on solutions, and these are being scaled up, and strong mechanisms exist for equitable delivery. I give you callbacks. However, in some cases, demand and utilization is suboptimal. We haven't expanded the use of rapid diagnostic tests as much as we would like. and equity is still under threat, as the DG outlined in his speech. So we collectively know much more than we did 1 year ago. We've developed the operational scientific solutions, but we have not yet applied that knowledge and those solutions comprehensively or evenly. In 2021, obviously, we need to redouble our efforts to suppress transmission, protect the vulnerable, and save lives in a comprehensive, coordinated, and equitable fashion. That's the slide I put up the last time. Nothing has changed. These are still the core. I would say that right now we need to focus on ensuring that exposure does not lead to infection. The best way to do that is to vaccinate. And I think Bruce is going to follow up and give you a sense of where we are on the Act on both vaccines, diagnostics, and therapeutics. Finally, looking ahead, we need comprehensive and integrated strategies. We have to align, but at local, national, and at global level, there are many, many strategies, many, many plans. They need to come together. We need to prepare, empower, respond, accelerate, strengthen, adapt, and integrate. We need, as WHO, to bring together the SPRP, the Act, and our strengthening health systems together into a single program under the framework of the GPW 13. And we need to integrate that across with the rest of the UN system and the other socioeconomic frameworks and the recovery plans. The danger right now is that we get an epidemic of plans and that we don't have the focus we need to support our member states and our countries. So with that, I will hand over to Bruce, and he's going to take us through the progress with the ACT Accelerator. And Soumya Somanathan is here, and I think others, Mariangela, Bruce will introduce those who are here.
Thank you very much, Mike. Good afternoon, Chair, Excellencies, ladies and gentlemen, Director General. Over the next 10 minutes, I'll provide you an update on what we're doing to accelerate access to vaccines through the ACT Accelerator and COVAX. We've prepared some slides that we thought might facilitate the member states' review of this issue, but I understand it'll take a moment or two to upload those. So as they are uploading the slides, I'd like to highlight that this work really cuts across the work within WHO's Science Division, Regulatory and Medicines Divisions, allocation work streams, emergency groups, and vaccines group. So I'm presenting on their behalf as it provides an overview of the entirety of this work. But as we go to questions and member state issues you'd like clarification on, we'll call on all of the leads in those areas, particularly our chief scientist, Dr. Soumya Swaminathan, who leads the COVAX area of work within WHO, and Mariangela Samau, who leads, of course, our regulatory and allocation work. If I might have the next slide, please. So first, I'd like to provide a couple of slides to give you an overview of the state of vaccines globally so that we're all on the same page with respect to their rollout. From there, I'll move to the status of the COVAX vaccine rollout, and then to actions that can be taken by member states, the Secretariat, and our partners to accelerate access. As you can see on this slide, vaccination, the first program began 42 days ago. I highlighted it was 23 days since EU member states received delivery of products, because that was when there was a substantive step up. So we're within 30 days, frankly, of the delivery of vaccines. I think that's an important point to remember, because often in the press to get them out as rapidly as possible, we forget how recent this has been. To date, 40 million doses of vaccine have been administered. This is as of this morning, with 95% of those in 10 countries. There are 7 different vaccines we know now on 3 different platforms, perhaps a 4th as of today, that have been administered, and they're highlighted in the footnote below. So vaccination at this point has started in 50 countries, and to the point the Director General made, this includes 40 high-income countries, 8 upper-middle-income countries, 1 low-middle-income country, and only 1 low-income country. If we move to the next slide, this map, which is not a WHO official map, it's simply for illustrative purposes from our world in data, demonstrates which countries have so far administered COVID vaccines. As you can see, the majority of those vaccines in the northern hemisphere, although there are some now in the southern cone, southern parts of Latin America, but Africa, large parts of Central Asia, Middle East still have not initiated vaccination, as well as the Western Pacific. Important to note when you look at a graphic like this, however, are the products that are being used. Oh, by the way, excuse me, but the darker colors, of course, represent a higher number of vaccines per or administered per 100 people. If we just click once more on this slide, I wanted with the bottom panel to highlight which vaccines are being, which vaccines this is really relying on. And you can see in this bottom panel that of the 50 countries that are vaccinating, 44 of them are relying on the Pfizer-BioNTech vaccine, one of the mRNA vaccines, followed by Moderna, and then the other products which are built on a variety of platforms, viral vector platforms, inactivated products, etc. So 39 countries are using one vaccine, and 11 have started to use 2 vaccines. But this is an important graphic given some of the comments made following the Director General's report, which highlighted the challenges around mRNA vaccines. The Pfizer vaccine, you'll remember, requires a non-standard syringe. It requires a diluent. It requires an ultra cold chain at -80 degrees. And of course, the capacity to manage a relatively high rate of anaphylaxis reactions. It is a difficult product to incorporate into vaccination programs in many countries. This is one of the reasons that many countries did not prioritize this as a product in the initial decision-making around these products. We just click once more. I would also highlight that of all of the products that are currently in use, there's 7, 2 of them have currently received WHO emergency use listing and or emergency use listing by a stringent regulatory authority, that is emergency use authorization by a WHO recognized or WHO listed authority. Consequently, the world is, and COVAX facility, highly dependent on those 2 products as it moves forward before the other products that you see go through a regulatory process. If we just move to the next slide, please. Now I'd like to switch from what the situation looks like globally to the work being done in the COVAX facility to accelerate vaccination through the facility. The first thing I'd like to highlight is that the facility is in a strong position to begin vaccinating, and the aim is to initiate deliveries as soon as February. I'll come back to what the challenges to that will be and how member states may help. But if you look to the left-hand side, I would remind that COVAX now has firm deal for 2 billion doses and options for over 1 billion additional doses. This is across 6 products as of Friday and 5 producers. And as I mentioned, over $1 billion in doses, in options. If we click once more, please. In addition, to complement the deals and recognizing that many of the doses and products that have currently been produced are actually controlled now or contracted by a very limited number of countries, COVAX put in place in December of 2020 a mechanism for sharing doses with the COVAX facility. Discussions are ongoing with a number of potential donors, but as of today, we do not have confirmation of dates, volumes, or products for, or of the combination of all 3 for potential donations to the COVAX facility. I'd highlight that these donations, while they would complement the deals that are already in place, they could be very important to early access to key products such as the Pfizer product in particular, which is already contracted by a limited number of countries with bilateral deals. If we move to the next slide, please, I'd like to switch to the country perspective, because we're often asked, great, you have the contracts, but are countries ready to use the vaccines? And I'd like to highlight here with some data the point the Director General made this morning, that COVAX participant countries are indeed ready to begin administering COVID-19 vaccines. If we look first in the area of country readiness. This is the on-the-ground work that needs to be ready to receive, to regulate, and then begin the rollout of vaccines. 88 of the 92 AMC countries have submitted their vaccine request form, which includes a detailed report on many elements of readiness. Through the extraordinary 100-100 initiative we've been talking about in member state briefings, over 120 countries now have completed their readiness assessments, including nearly two-thirds, over two-thirds now of the AMC countries. And we believe that about 50% or over 50 of these, have now got detailed national vaccine deployment plans in place, which means they have systematically worked through the cold chain, communications, policy, and related issues across 9 domains necessary to be able to roll out these products. So without a doubt, COVAX participant countries are ready to begin vaccinating. In addition, great work has been done to establish the necessary regulatory pathways for rapid in-country import and emergency use authorization. And perhaps one of the most challenging areas, which is right at the very bottom, are now being addressed or have been addressed. And these are in the areas of indemnification and liability. Because you'll remember what we're doing now is truly on a historic scale in terms of the rollout of an unlicensed product, a product with emergency use listing, which requires indemnification of companies in every country in which these are used, as well as a no-fault compensation mechanism to facilitate the use and the compensation of any severe adverse events. These are very difficult mechanisms to put in place, given that COVAX is working across 190 countries, 190 plus now, and 92 AMC countries. So a big breakthrough just this month, the last couple of weeks. Model indemnification language has now been established for all products and shared with all 92 AMC countries to facilitate the rapid establishment of the necessary indemnification agreements. In addition, again, through some extraordinary work by WHO's legal department, a no-fault compensation mechanism has been developed and will be concluded and rolled out in the coming weeks. This will not be a barrier to initiation of vaccination because of the provisions of the compensation mechanism over time. Next slide, please. Skip again, please. Next slide. This slide here, I would like to show you what the pipeline looks like in terms of the COVAX vaccines by time. And this responds to a specific question from member states this morning. What you can see here is of the 3 billion doses that COVAX is aiming to contract, so these are either contracted doses or option doses already, 2 billion will be ready for delivery in 2021. That's even after potential attrition as a result of supply or other problems. If you look at the color coding here, you can see the importance of 2 vaccines in particular, the AstraZeneca vaccine and the Serum Institute of India vaccine, the AstraZeneca one of the 2 vaccines they're making. As you can see, we have combined volumes contracted for over 130 million doses of those vaccines in the first quarter of 2021, which could begin rollout as early as February. The crucial thing right now is both products have got to go through a full regulatory review to ensure their safety, efficacy, and of course, quality. That process is well underway, and Dr. Samau may wish to comment on later. As you can see, as we move into the second and subsequent quarters of the year, the number of doses that will be distributed through the COVAX facility dwarf what has already been rolled out globally. I would remind you that that 135 million in the next 2 months compares against the total of only 50 million doses that have been rolled out globally to date, and more than half of which is just in 2 countries, those being the United States, of course, and America and China. If we move to the next slide, here are the crucial actions to make sure that that timeline you just saw is actually achieved. First and foremost is the WHO regulatory review of these crucial products I just showed you. The mRNA vaccines are important, but they're extremely difficult for many of the environments we work in, and many countries would prefer to have alternatives. They're also extremely expensive. If we buy some of the mRNA vaccines, it means we buy much less of others. And what we are gunning for is to get 20% of the world at least vaccinated this year and more, ideally. So we want the limited resources available to go as far as possible. Those decisions, by the way, on the mRNA vaccines were taken in consultation with the COVAX facility participants. So the two key sub-bullets you see under regulatory review. First is expediting the receipt of the full data and its review for priority contracted products. I mentioned the SII AstraZeneca product and the SK Bio product, that's the AstraZeneca vaccine in Korea. These are the crucial products to really scale up rapidly with programmatically manageable or more optimized, let's say, products. And then to process the full dossiers that have been submitted to date on other products. We'd like to appreciate the work of both Sinopharm and Sinovac, who have provided us with full dossiers, or what we believe are full dossiers as we go through them. So we are expediting the regulatory review of those products. Now, you see a link there just below the regulatory review, and I'd like to highlight this because if you click on that link at any time, you'll see a table like represented on the right-hand side that shows you exactly where each product is in the regulatory process, because I know member states, and the Director General highlighted this morning, want to ensure products that are safe, efficacious, and quality assured. And if all the ticks in the box on the right-hand side are positive for each of the products that are listed, you will have confidence in that regard. To date, we have, of course, only provided an EUL, or emergency use listing, for one product, which is the Pfizer product, because that company provided full data in November, December. The second priority you see listed here is with respect to the COVAX portfolio itself. You've seen the importance of the Pfizer product to rolling out vaccines globally in the numbers I presented earlier. We are in, with thanks to the Director General, detailed discussions with Pfizer. We believe very soon we will have access to that product, and then we will look beyond in terms of extending the portfolio. We are also looking at other opportunities from other advanced candidates, such as some of those which have already submitted for regulatory review. We'd like to highlight that dose sharing can be a very, very important part of the near-term solution. As you saw in the rollout in the early slides, most countries are beginning with very few doses to learn how to use these vaccines, and they're prioritizing like their frontline healthcare workers. We're putting in place a plan through COVAX with our participating countries to use Pfizer doses if we can conclude the deal and receive donations for them very, very quickly. So we would be very keen to try and translate a lot of the commitment and interest to dose sharing to actual deals, particularly with countries that have large bilateral deals on key products. And then finally, in the area of in-country readiness, we have key work ongoing to ensure the regulatory authorization and legal frameworks are in place, not just in some countries, but in all countries, to be able to roll out rapidly. I remain concerned that while many countries have got communications and other pieces of readiness in place, these key legal frameworks will take time and could be a barrier to access if that work is not initiated as rapidly as possible. Our country offices and regional offices are doing fantastic work to support member states, and they're there and available to help you on these issues. The last couple of slides, if I could just have, please, I'll pop up quickly. I'd like to remind you, as Mike said at the beginning, that all of this is happening within the context of the bigger ACT Accelerator initiative that looks at diagnostics, therapeutics, and in-country capacities through the health systems to be able to deliver these products. We are right now in the process of developing what we call a refreshed strategy, because some of the fundamentals have changed in the environment we're working on, and Mike, you alluded to these. The unmet demand now for vaccines, evolving viral mutations, escalating bilateral deals, all of this requires us to adjust our strategy and needs for 2021 across all products. We are in the process of doing that, and we'll be presenting the updated refreshed strategy and budget to the Council on the 9th of February. we're hoping to provide a briefing to our member states at the MS COVID briefings immediately beforehand. With my final slide, I'd like to summarize some of the points that we've been discussing. Last slide, please. And so here's some big points, and really they reinforce some of the points that the Director General made this morning. So in terms of accelerating COVID-19 vaccine rollout globally, first, COVAX is in a very strong position. It aims to start deliveries in February. It can only do that with the assistance of 3 key players and a 4th that I listed here as well. First, countries with bilateral deals. Urged to be transparent with COVAX so we know what vaccines are going where, and we can be sure the unserved are getting served rather than some countries getting double served. Also to work with us and producers to prioritize COVAX's place in the queue, so to speak, as well as the dose share. Director General highlighted these points this morning. With the producers, we urge them to rapidly provide the full regulatory data. Some producers have unfortunately prioritized provision of data to countries with whom they're doing a bilateral deal that slows down global access. Also to prioritize the COVAX supply contracts and facilitate donations and dose sharing from those countries that want to dose share with COVAX. And then thirdly, among the countries introducing vaccines, urging, as the Director General said this morning, to use only products that meet the rigorous international standards, such as those represented and reflected in WHO's emergency use listings. My final comment to donors, we have the financing to kick off and start this first quarter deliveries and begin the second quarter. But as we get further into this year, we have to close the $4.6 billion gap in financing to actually procure the vaccines, as well as the $1.8 billion gap in delivery and the about $1 billion R&D gap, which is crucial to optimize the products and to begin addressing variants as we go forward. So with that, Mr. Chairman, we would be happy to address any further questions member states might have, and the Executive Board, pardon me, in particular, on how we can accelerate the rollout of this vaccine globally. But just to summarize once again and reinforce the point, we are in a strong position to move out with vaccines globally. We just need the assistance of our member states in particular to make sure that becomes the reality.
Thank you, Secretariat. The floor is now open for discussion. I would like to request that the Secretariat moderate the discussion on the virtual platform. Secretariat, you have the floor, please.
Thank you, Your Excellency, Mr. Chair. May I kindly remind those wishing to make an intervention to please raise their hand in the Zoom platform. I should now like to call upon the distinguished delegate of India to be followed by Argentina. Thank you, and India, you have the floor.
Thank you, Chair. India takes note of the report of the Director General on WHO's work in response to COVID-19 in the light of WHO Resolution WHA 73.1/2020. Challenges posed by the COVID-19 pandemic are enormous and multidimensional. In a way, it took UN system, WHO, the regions, and the member state by surprise and once again established that the world is still not prepared for a pandemic onslaught. Acknowledging the challenges posed by the pandemic and limitation of the global public health system, India feels that while World Health Organization performed well in many areas, however, there is scope for improvement in others. WHO's work in technical areas, such as providing guidance on almost all the aspects of pandemic capacity building in terms of training resources, situational awareness, etc., were commendable. However, operational areas like risk assessment and critical mission related to it, emergency response, and in particular deployment of emergency medical teams on international support mission, managing supply chain management, negotiation with key manufacturers and suppliers on COVID-19 related products are areas which needs more focus. This is crucial in the context of implementation of COVAX and Act Accelerator for timely availability of cost-effective diagnostic, therapeutics, and vaccine. Chair, the timely detection of the new variant found in UK and South Africa was facilitated by epidemiological and technical know-how in these countries. WHO should create a collaborative network of laboratories capable of genomic sequencing of large number of samples, supporting less resource countries in early identification of mutation, if any, besides creating capabilities for analyzing large volume data and near real-time sharing of information with member states. Chair, India has always highlighted the centrality of WHO as focal point for global health. We look forward to additional measures at a WHO level to create a robust mechanism for technical support and guidance for any similar pandemic in the future. Thank you.
Thank you, India. And now to Argentina, to be followed by Bangladesh and then the United States of America. Thank you. Argentina, you have the floor.
Thank you, Chairman. Argentina takes note of the report and is very grateful for them. We believe that that reports such as that by the IPPR should be published with more time so that we can look at them and consider them in due course. The COVID-19 pandemic has challenged all of the provisions of the IHR, and indeed it has shown the need to place IHR at the top of the UN agenda, and heads of state also need to be involved in facilitating implementation. We underline the importance of surveillance mechanisms and accountability frameworks for preparedness and response and cooperation. However, we believe that it's vital that these activities are voluntary. We are convinced that we have diagnostics and we need now to focus on responses. We see that there is a warning system, it's a gradual one, and it could actually make it too bureaucratic to comply with the IHR. We welcome the guidelines by the Emergency Committee and the initiatives to incorporate digital technologies into track and tracing. However, we reiterate the importance within the member state recommendations for WHO to have a clear position on requirements for essential trips, travel and non-essential travel, and considers it important to identify alternatives for additional measures. Finally, we call attention to inclusion in the conclusions of the document EB 148/18, paragraph 12, referring to the proposal by the Council of Europe on a treaty for and affecting the possibility for analysis and debate. Thanks to a global effort, unprecedented global effort in the work of WHO, we see that there is an approval of an increasing number of vaccines. And as the DG has said, we encourage the international community to avoid future interventions that may lead to a lack of supply and make it more expensive and difficult to gain access to them. We support the statement by the Global Federation of Public Health Associations and the Open Charter for Equal and Sustainable Health. We believe there should be a waiver of intellectual property rights for global public goods. Thank you very much indeed.
Thank you very much, Argentina. And just a reminder that we are currently taking interventions on agenda item 14.1. Thank you very much. We shall now give the floor to Bangladesh. You have the floor. Thank you very much.
Thank you, Madam Moderator. Mr. Chair, I would like to thank the Director General for his report on the update about the Secretary's activities to combat the COVID-19 pandemic. Bangladesh attaches great importance to the cooperation between it and the WHO. The government of Bangladesh has been able to mitigate the onslaught of COVID-19 pandemic under the able leadership of our Honorable Prime Minister. However, the pandemic has already caused unprecedented devastation, affecting our way of living, the economy, our lives and livelihoods. Our National Preparedness and Response Plan for COVID-19 reflected a whole of this government approach to tackle this pandemic. The government has also allocated around $14.14 billion US dollar stimulus package, which is equivalent to 4.3% of our GDP for sustaining and eventual recovery from this crisis. Mr. Chair, as you know, Bangladesh provided temporary shelter to over 1.1 million forcibly displaced Rohingyas from Myanmar. It has been more than 3 years, regrettably, not a single Rohingya could be repatriated. Despite multiple challenges, our government, with the support of international community, has been providing necessary health facilities to them. Provisions of effective health measures have helped this community from this health outbreak. We are happy to know that the COVID-19 vaccines have been successfully developed and their distribution has already begun. In this connection, we would like to emphasize on ensuring fair and equitable access to COVID vaccines for all. The COVID-19 vaccines must be treated as global public good. The WHO initiative of SCT Accelerator and COVAX facility can play a vital role in this regard. COVAX facility has brought hope for all, particularly low and middle-income countries, to get the vaccine. Bangladesh is one of the COVAX facility-supported COVAX AMC country. We expect the vaccine to be distributed to the AMC countries soon under the COVAX facility. Mr. Chair, I wish to make following points for your consideration. First, WHO should continue to advocate for ensuring equitable and affordable access to medicines and vaccines of COVID-19. Second, we ask WHO, Gavi, CEPI, and UNICEF to take urgent action to distribute vaccines to the COVAX AMC countries as early as possible and provide necessary training facilities to them for effective, efficient vaccination framework and protocol. Third, we request WHO to assess the impact of COVID-19 on mental health and assist the member states to mitigate the negative consequences in this regard. Finally, Mr. Chair, the pandemic has exposed the gaps in our efforts to build a robust and inclusive public health system. There must be a stronger international partnership to meet the needs of low and middle-income countries through timely and adequate development and technological assistance. I thank you, sir.
Thank you, Bangladesh. And now to the United States of America, to be followed by Austria.
Thank you, Chair. The United States thanks the Secretariat for the report on the WHO response to SARS-CoV-2. All WHO member states have been impacted by this pandemic. For all who have lost loved ones, we offer our condolences and sympathy. We resolve to continue to fight this scourge. It has been over a year since the outbreak of SARS-CoV-2 began, and almost a year since the Director General declared it a public health emergency of international concern. It has been 8 months since WHO member states overwhelmingly adopted Resolution WHA 73.1, calling for, among other things, an investigation into the origins of the virus as soon as possible. The team, which finally arrived last week, will only be successful if it is provided with the following information currently in the possession of Chinese authorities. First, all studies produced in China on the presence of SARS-CoV-2 related genetic sequences in animals, animal testing results in and around Wuhan, Hubei province, environmental samples from the markets, and comparative analysis of genetic data and samples. Also, all studies produced in China on human data, including but not limited to comparison of the earliest genetic sequence from humans, human SARS-CoV-2 serology data from 2019, and epidemiological spread data, as well as access to caregivers, former patients, and lab workers for interviews and medical data and samples. And finally, all studies produced in China concerning comparative analysis of animal, environmental, and human genetic and epi-spread data to look for overlap and potential sources. We must emphasize the importance of continued sharing of data and samples related to SARS-CoV-2. With the emergence of new variants that may impact key attributes of the virus, it is important for the global scientific community to continue to have access to genetic sequence data, samples, and other pertinent information in an open and timely manner. We would like to thank the United Kingdom and South Africa for their prompt, open, and detailed sharing of the technical, scientific analysis and information regarding these SARS-CoV-2 variants. We would also like to thank Brazil, Japan, Mexico, and other countries for their rapid and transparent reporting and sharing of information on these variants. We have a solemn duty to ensure that this critical investigation is credible, and conducted objectively and transparently. Finally, Mr. Chairman, please allow me to express our concern over some member states imposing COVID-19 related restrictions on imports of food and agricultural commodities. We highlight the need for strong WHO leadership and for member states to allow the delivery of goods to minimize disruptions to the global food supply chain. Thank you for your attention.
Thank you to the United States, and now to Austria, and to be followed by Indonesia. Thank you. Austria, you have the floor.
Thank you very much, Mr. Chairman. I speak on behalf of the European Union and its member states, and I apologize for having been somewhat overly eager this morning and presented the statement at too early a stage. This statement is also made on behalf of 3 candidate countries, that is to say the Republic of North Macedonia, Montenegro, and Albania, as well as the Republic of Moldova. They all align themselves with this statement. WHA Resolution 73.1 constituted the first joint response by the WHO's membership to COVID-19. It showed that multilateralism, international cooperation, and solidarity work and are the most adequate answer facing a pandemic. We welcome the progress made by the Secretariat and Member States in the implementation of the resolution. Proactive follow-up remains key to guide our responses, WHO Secretariat and Member States alike. For the global response, equitable access, rapid development, and fair deployment of COVID-19 vaccines, therapeutics, and diagnostics, as well as the strengthening of health systems for their deployment, are essential. In partnership with WHO, the EU has been playing a central role in setting up, funding, and co-hosting ACTA as the central mechanism to achieve these goals. We support the full realization of ACTA, including its vaccines pillar, COVAX, which we support both via the AMC and as a self-financing participant, so that all who need COVID-19 vaccines can have access to them. To ensure ACT's success, we encourage support of all member states and stakeholders. We also need to address the funding gap, as well as the gap in vaccination between countries. Vaccine donations are also to play a key role. The EU will continue to be a reliable partner and champion for resilient health systems and universal health coverage on one health approach at all levels, and the objectives of the Global Action Plan for Healthy Lives and Well-being for All to reach the SDGs and to strengthen cooperation among health actors. Mr. Chairman, WHO is an evidence and science-based organization for global health. In this spirit, the resolution asks for an investigation of the source of the virus. Understanding the origin will enable us to better control and respond to this pandemic and future health threats. We welcome that the international expert team was finally allowed to travel to China to start their investigation in cooperation with Chinese counterparts. We attach great importance to this investigation, which requires transparency, access to locations and data, and full cooperation, and we request to be regularly briefed on progress. Given the danger posed by emerging mutations of the virus, we underline the importance of sharing of genetic sequence data. We thank the UK, South Africa, and other countries for sharing insights and data quickly, and welcome WHO's increased efforts to expand scientific cooperation. Distinguished colleagues, 2020 was a year of doom. We all hope that 2021 will be a year of hope. However, the pandemic is far from over. We all must continue working hard, nationally, regionally, and globally, through multilateral cooperation, trust, and solidarity. With the help of the evaluation processes currently underway, we also need to learn from our mistakes and make bold moves to better prepare for and respond to future pandemics, even whilst combating and recovering from the current one. Thank you very much.
Thank you very much. And now to Indonesia, to be followed by Australia.
Thank you, Chair. We appreciate the WHO works during the pandemic, such as issuing technical guidance and accelerating the development and ensuring access of vaccine, therapeutic, and diagnostic. We reiterate our support to the work of the accelerator to ensure the equitable access of COVID-19 tools. Are at a critical in the COVID-19 response, where the early COVID-19 vaccine is being rolled out globally. The scarcity of vaccine supply and limited country readiness have prevented many countries, especially developing and LDCs, starting their vaccination program. Moreover, lack of trust of the general public on the safety and efficacy of the vaccine also proved to be challenging. In line with the Emergency Committee observation last week, my delegation would like to reiterate that member states, WHO, and other stakeholders should ensure equitable access to the COVAX facility and technology transfer to increase global production capacities. Encourage vaccine manufacturers to rapidly provide safety and WHO for emergency use listing and treat COVID-19 vaccine as public goods. Mr. Chair, Indonesia has started to roll out its first of our 4 stages of COVID-19 vaccination program. The first stage started health workers and other frontliners before gradually vaccinating other population groups. This approach has been formulated based on the recommendation by both Strategic Advisory Group of Experts and Indonesia Technical Advisory Group on Immunization to determine the vaccine and prioritizing approach. Given the increasing spread of COVID-19 infection that is being compounded with the growing spread of the mutating virus, we continue to implement comprehensive approach to the COVID-19 response. This included through intensifying test tracing and treatment effort, public advocacy, enforcing health protocol, and ensuring the availability of resources for self-isolation and treatment. Although there are still challenges to control the transmission, the approach has showed good results, such as in terms of cure rate. Chair, the human history has shown that inequality is not only unjust, but inequalities will ensure that someone will be left behind against our ultimate SDGs principle. Therefore, we should collectively address one of the current biggest challenges, that is ensuring that vaccines are distributed equitable to all countries. I thank.
Thank you very much. And now to Australia, to be followed by Botswana. Australia, you have the floor.
Thank you. Australia appreciates the substantial activity by WHO to support the global COVID-19 response, as clearly detailed in the report. The COVID-19 pandemic continues to test us all, and it's a powerful reminder of the importance of strong global systems, which allow us to respond collectively to problems that cannot be solved by countries acting alone. Inclusivity has never been more important as we confront the unprecedented health, economic and social impacts of the pandemic, and it is essential that no population or potential partners are excluded. COVID-19 has put great pressure on the delivery of essential health services. Strengthening of country-level systems as first lines of defence against COVID-19 and other emerging infectious diseases, alongside full implementation of the WHO Health Emergencies Programme, is fundamental. We note substantial operational and technical support has been provided to many countries by the WHO. Additionally, the overview of the global situation, progress made, and impact in country, detailed in the Strategic Preparedness and Response Plan Monitoring and Evaluation Framework, provides useful guidance, identifying gaps for action. We appreciate WHO's efforts to support the preparedness of the Pacific region, in particular through targeted deployments of the Global Outbreak Alert and Response Network, as well as WHO's ongoing leadership, convening regional joint incident management team meetings, and providing up-to-date epidemiological reports. Clear and credible information also continues to prove vital to response efforts. WHO's role in providing authoritative, evidence-based and timely information is fundamental to fight this pandemic. Australia is actively following the progress the WHO convened scientific study into the origins of COVID-19. We note the international expert team has arrived in China and expect they will have access to relevant data, information and key locations to inform their work. We continue to seek transparency and look forward to WHO's regular updates on progress. Global participation in the COVAX facility will support rapid, fair and equitable access to COVID-19 vaccines. Australia has invested in the COVAX Advanced Market Commitment to support lower income countries and eligible small economies to access safe, effective and affordable vaccines for their highest risk groups. Australia is also committed to ensuring access to safe and effective COVID-19 vaccines for the Pacific and Southeast Asia through our Regional Vaccines Access Initiative. Finally, it is crucial that countries are ready to receive COVID-19 vaccines when they are available. WHO's ongoing work to support the development and finalisation of national deployment and vaccine plans is critical to ensure an equitable global rollout of COVID-19 vaccines. Thank you, Chair.
Thank you, Australia. And now to Botswana, to be followed by Colombia.
Thank you, Chair. Botswana is pleased to deliver the statement on behalf of the Africa Region member states. We thank the Director General for the detailed and informative report on the COVID-19 response. The Africa Region commend the WHO leadership and the coordination role across all levels in the COVID-19 response. The WHO's Health Emergency Program, which was established under the leadership of the Director General, Dr. Tedros, has been a key milestone in this regard. We appreciate the technical and operational secretariat support, missions, and expansion of the hospital bed capacity, infection prevention and control support, SARS-CoV-2 laboratory testing capacity. The region has utilized the tools available, including the COVID-19 Strategy Preparedness and Response Plan, Partners Platform, and the various technical guidance documents. We congratulate the Secretariat on the global collaborative effort on the access to the COVID-19 Tool Accelerator, which is a key initiative to promote equitable access to COVID-19 vaccines, treatment, diagnostic, and all other medical products. We look forward to an ongoing, transparent, and inclusive update on the successes of this initiative for the benefit of member states. Chairperson, the Africa Region is concerned about the disruption in the global supply chain, particularly during the initial phase of the COVID-19 crisis, which significantly affected our response. We are, however, confident that the Secretariat, in partnership with other UN agencies and philanthropic organizations, will continue to ensure equitable allocation of critical items, which include personal protective equipment comprising medical masks, respirators, oxygen concentrators, pulse oximeters, ventilators, and other essential biomedical items for clinical care, particularly to low and middle-income countries. The region notes with appreciation WHO's ambitious target for the distribution of the COVID-19 tools, including the provision of 2 billion doses of vaccine to all countries by the end of 2021, and 245 million treatment courses and 500 million diagnostic tests to low-income and middle-income countries by mid-2021. Chair, as reported by the Independent Panel on Pandemic Preparedness and Response, there is a great inequality in the COVID vaccine availability and rollout amongst and between nations. The report indicates that our region will be the last to receive enough vaccine coverage for public health impact is deeply concerning. We therefore call for the urgent global solidarity to prioritize investment in affordable and safe COVID-19 vaccines and equitable allocation based on the principle of fairness for public health impact. Regarding research and development, we thank the Secretariat for supporting several scientific studies on the new diagnostics, vaccine, and therapeutics. It is important for WHO to continue to ensure that representation of public health researchers and scientists of the region in WHO stakeholder forums in order to expertise and forge partnerships. We appreciate assessing member states to follow the new COVID-19 vaccines, diagnostics, and therapeutics effectively and efficiently as they become available. Chairperson, in conclusion, the Africa region commits to working with the Secretariat and partners for readiness of the vaccine introduction. I thank you.
Thank you. And now to Colombia, to be followed by China.
Thank you, Chairman. We are grateful for the report which has been submitted by the Director General on WHO's response to COVID-19. It also, of course, covered the support provided to countries to help them build national preparedness and response plans to deal with the current health emergency. We hope that WHO will continue to provide us with general support so that we can implement our plans most effectively. Nationally speaking, Colombia has a contingency plan for the COVID-19 emergency. We've had that since April last year. And we also have a COVID-19 health response strategy. These plans include 169 different types of activity for the preparedness phase, 64 for the containment phase, and 70 for the mitigation phase, all of them based on scientific evidence which is available worldwide. At the moment, we're focusing on the mitigation stage, and under the leadership of the Ministry of Health and Social Protection, we have rolled out nationally a program for testing, tracing, and isolating cases so as to ensure that we can break the chain of transmission by picking up confirmed and suspect cases, isolating confirmed cases and their contacts, and carrying out testing. It has, however, been important to include financial support so that people will comply with self-isolation measures. Nonetheless, we still believe that the preparedness stage needs to be strengthened, and we would like to have support from WHO in this. Previous emergencies, such as the H1N1 and recently Zika, chikungunya, and measles outbreaks, have shown how necessary this is. They helped us, actually, those outbreaks, to improve our preparedness, and that has helped us to better tackle this pandemic. However, we still need to strengthen the preparedness phase further. We believe that WHO support on the preparedness issue is essential so that we can learn the lessons which the COVID-19 pandemic has been teaching us. Last but not least, we'd like to encourage WHO to continue with its advice on designing and building vaccination programs and plans so that we can begin our campaigns to vaccinate against COVID-19. We also urge fair and equitable allocation of vaccines, treatments, and diagnostic kits. And we hope that the organization will continue to help us monitor the impact of the pandemic on our basic health services. Thank you.
Thank you. And now to China, to be followed by Kenya. China, you have the floor.
Thank you, Mr. Chairman. The Chinese delegation thanks the DG for his report and appreciates WHO for its tireless efforts in response to the COVID-19 pandemic. China holds that WHO's efforts in response to the COVID-19 pandemic are very effective. Since the outbreak of COVID-19, China has always been open, transparent, and responsible by publishing timely information, sharing genome sequencing, primer, and the probe of the virus, as well as the experiences and the programs in prevention and control, recognizing the difficulties of other countries in the pandemic. We have actively provided assistance to them within our capacities. We again urge all parties to strengthen cooperation, join hands to fight against COVID-19. Together, we shall build a community of common health for mankind. Virus origin studies are of scientific nature. It needs coordination, cooperation. We must stop any political pressure. In the fight against COVID-19, China is willing to continue to support WHO's global emergency response in terms of personnel, finance, and materials. Thank you, Mr. Chairman.
Thank you. And now to Kenya, to be followed by Tonga. Kenya, you have the floor.
Kenya aligns a statement with that made by Botswana on behalf of the African member states. Kenya takes note of the report presented by the Secretariat to the Executive Board and appreciates WHO's continuing work on the response towards COVID-19 pandemic. We also appreciate WHO's operational and technical support provided to countries in the pandemic response activities, including building laboratory capacity, epidemiology, infection prevention control, case management, and data management. We acknowledge the WHO's coordination role in strengthening the global COVID-19 supply chain system to scale up the procurement and delivery of personal protective equipment, diagnostic products, and clinical care equipment to low and middle-income countries such as Kenya. Kenya reported our first case on 13th of March 2020. To date, the country has reported over 98,000 confirmed cases with over 1,700 deaths of COVID-19. To curb the spread of the virus, Kenya continues to maintain heightened surveillance at the port of entry, increased diagnostic capacity, dusk to dawn curfew, mandatory screening for travelers, as well as continued implementation of public health measures such as social distancing, hand hygiene, and mandatory use of face masks in public places. To ensure continued delivery of essential services in the context of COVID-19, Kenya, with support from the WHO, has developed more than 85 protocols and guidelines to guide healthcare workers on continued service delivery amid the COVID-19 pandemic. On COVID-19 vaccine preparedness, Kenya seeks to vaccinate its population against COVID-19 disease using a phased approach, starting with at least 20 million individuals, that is about 40% of the entire population, over the next 2 years. Their first phase targets to vaccinate 1.25 million frontline healthcare workers and other essential workers by June 2021. A ministerial advisory committee on COVID-19 vaccine introduction has been established to oversee the implementation of the country's vaccine rollout strategy so as to ensure equitable access and that most at-risk and vulnerable populations are prioritized. Finally, Chair, we call upon the global community to work together towards controlling the COVID-19 epidemiological situation and look forward to the gradual resumption of normal socio-economic activities in the foreseeable future. Thank you for your attention.
Thank you. And now to Tonga, to be followed by Singapore. Tonga, you have the floor.
Honorable Chair, WHO Director General, Your Excellencies, Maloelele from the Kingdom of Tonga. On behalf of His Majesty's government, I thank you, Chair, and wish to firstly acknowledge and salute the WHO DG's courageous global visionary leadership. I also wish to acknowledge the sacrifice of the WHO scientist team and staff, and global healthcare workers and researchers. We also would like to acknowledge the Regional Director, Dr. Takashi Kasai, ethical and inclusive leadership. The Kingdom wishes to acknowledge the WHO DD's report and his strong stance on equitable distribution of the vaccine. History will judge us tomorrow on what we did today, especially ensuring vaccines accessibility for those countries without wealth. We would like to acknowledge tremendous support provided by various partners. In the Pacific, we would like to acknowledge the support provided by Joint Incident Management Team, with major partners joining as team with WHO as Secretariat. While most of the Pacific countries remain free of COVID-19 or without community transmission, the pandemic has catalyzed government's acceleration of actions to achieve our commitment to universal health coverage. We strengthen treatment and laboratory capacity for COVID, and this will also contribute to better health service delivery for the future. We have also engaged with community leaders, governors, district officers, community police officers, and that have been the fundamental essence, unifying a nation from the bedrock of communities. As in many countries, Tonga is currently preparing for mass vaccination campaign. Tonga is applying for vaccine through COVAX facility. And with small island nation, the risk of a deadly pandemic can eradicate a generation. We have developed national deployment and vaccination plan. Under this plan, we will further strengthen our cold chain system, storage capacity, human resources, and health information, and pre-screening and preparation for potential side effects. We thank the continuous technical and financial support from countries and agencies. Finally, now is the time for supreme global genuine leadership from all of us to ensure vaccination for all of humanity. Thank you, Honorable Chair.
Thank you very much, Tonga. We are mindful of the time difference for you and for many other member states. We should now like to call upon Singapore to be followed by the United Kingdom. Thank you, and Singapore, you have the floor.
Thank you, Chair. COVID-19 had a deep and devastating impact on every country. Singapore has not been spared. The COVID-19 response resolution is a strong signal to the world that global solidarity is needed to win this war against the virus. Firstly, COVID-19 has reminded us of our interconnectedness and interdependency. Tackling this pandemic must be a collective effort built on international cooperation. As the specialized agency,
Elizabeth, you.
to act as the directing and coordinating authority on international health work, the WHO coordinated international health response to COVID-19 will continue to be strongly supported by Singapore. Secondly, we commend Dr. Tedros and the WHO for its continued leadership in mounting a global response at the international, regional, and national level. The regular press conferences and member states' weekly briefings are extremely useful in keeping the world informed about the latest developments and guidance. This provides transparency and inspires confidence. With the emergence of concerns about new variants, WHO's continued leadership and technical guidance remains even more important. Lastly, while the world is beginning to see the light at the end of this very long tunnel, vaccines alone are not the silver bullet for now. Safe management measures remain key, even as more people get vaccinated in the coming months. The world looks to WHO for leadership on technical guidance pertaining to the ability of COVID-19 vaccines to prevent transmission and how vaccination will interact with safe management measures. The next key challenge would be in the issue of verifying the vaccination status of travelers. An international authentication mechanism may be useful to aid the resumption of global travel and trade. Mr. Chair, let me conclude by saying that COVID-19 has shown the world the importance of investing in health emergency preparedness, especially in cities. As a small city state, our livelihoods depend heavily on Singapore being a key international and travel hub that remains open to the world. We must tread the fine line that safeguards both lives and livelihood. Singapore will continue to champion urban health emergency preparedness in the years to come, and we hope to work with like-minded partners to strengthen our collective resilience against future outbreaks. Thank you.
Thank you very much, Singapore. And now to the United Kingdom, to be followed by Sudan.
Estimado presidente, director general y distinguidos compañeros. Estimado presidente, director general.
Thank you, Chairman. Chairman, Director General, distinguished colleagues, no.
We seem to be having a technical issue. If we could kindly give the floor to the United Kingdom, please, who would then be followed by Sudan. I would please seek the help of IT in unmuting the United Kingdom. Thank you very much.
Thank you, Chair. Can I just check you can hear me?
Yes. We can indeed, and we can see you. Thank you so much.
Thank you, Chair. Science will reduce the impact of COVID. This includes drugs, vaccines and diagnostics, and international science is delivering them. As we all know, transparency and sharing information also saves lives in pandemics. The UK remains strongly committed to openness and sharing our experiences. We are very grateful to WHO and the international community for what they have shared and continue to share. The UK is currently at the worst point of this pandemic so far. Our health and social care workers are under immense pressure, and we are sure you will join us in paying tribute to their efforts and their colleagues around the world. We want to highlight two other items. Firstly, identifying important variants of the virus. Genomic sequencing helped identify new variants in the UK, South Africa and Brazil. It allowed us to share information quickly with all nations through WHO and other channels to support your handling. The emergence of new variants is no surprise, but we need to be ready to identify significant changes quickly wherever they arise. This includes those which are more transmissible or may reduce vaccine effectiveness. This will allow us all to respond in a timely way for the benefit of all. Variants present a global challenge that will require international cooperation. We must quickly consider how to put in place the necessary processes and structures to support a systematic global approach. We recognise that the UK is fortunate to have genomics capabilities and are committed to supporting the WHO to provide international leadership in this area and ensure systematic global surveillance. Secondly, therapeutics. We are pleased that the UK life sciences capabilities have been able to support WHO to contribute to major advances on therapeutics, in addition to work on vaccines. We are grateful to WHO for their leadership in coordinating efforts and including the Solidarity trial. There is a continuing need for trials to inform evidence-based global practice. For example, the recovery trial showed that dexamethasone, a low-cost and widely available drug, reduces mortality for COVID-19 patients requiring oxygen. It also demonstrated the lack of clinical benefit of other drugs, including hydroxychloroquine, and continues to explore other treatments with global relevance. The UK are also major contributors to other international trials, including REMAP-CAP. We remain committed to working in partnership to ensure global equitable access to safe and effective treatments and sharing research findings as quickly as we can. A strong scientific response, international cooperation and transparency are essential to get through this pandemic. By working together through science, we will save many lives. Thank you, Chair.
Thank you very much. And once again, our apologies for the issue in connecting you. I should now like to give the floor to Sudan, to be followed by the Russian Federation. Thank you. And Sudan, you have the floor.
I'd just like to confirm that you can hear me.
Indeed, we can. Thank you.
Honorable Chair, distinguished delegates, Excellencies. Sudan welcomes the updates by the Secretariat and commends WHO for their continuous prominent effort in catalyzing the global response to the COVID-19 pandemic. The pandemic has been a test for all of us, and while we now know much more than we did a year ago, we have a long way to go. Directing the bulk of medical resources of the country to address COVID-19, particularly the increasing number of cases, may have strengthened our initial response to the pandemic, but in retrospect, it has hindered regaining the function of the health system, which has not only affected the response to the pandemic itself, but has held back progress towards the ongoing crises within Sudan. Our support in terms of community-based COVID-19 surveillance, tracing, and tracking must also be strengthened and reinforced. The collateral impact of the COVID-19 on all aspects sheds light on the critical international community to provide holistic and support to the developing countries in their effort to tackle COVID-19, in addition to the steady strengthening of the capacity of the public health system and a pressing overall need for global solidarity. Sudan highlights the importance and calls on the international community to adopt a flexible funding strategy to rapidly tackle both COVID-19 obstacles, as well as maintaining a
Sudan, could you slow down, please? Thank you.
We are currently engaging relevant government entities to ensure a whole-of-government approach in the rollout process. We are also particularly keen...
Apologies for the interruption, Sudan. We're just being asked to kindly seek your indulgence in please slowing down the intervention somewhat for our interpretation services. Thank you so much.
Sudan highlights the importance of engaging in a multi-sectoral approach to ensure equitable distribution of the vaccine. We are currently engaging relevant governmental entities to ensure the whole-of-government approach in the rolling out process. We are also particularly keen on the involvement of the private sector on a national level, and we would like to encourage their early engagement on a global scale. We are currently working on finalizing the COVID-19 vaccine deployment plan with a nationwide rollout campaign expected to begin on the 1st of April. Sudan stresses urge WHO and member states to ensure equitable distribution worldwide. Finally, Sudan urges member states which have already begun the administration of the vaccine to speed up information sharing both in the region and globally. Thank you.
Thank you. Thank you very much, Sudan. And now to the Russian Federation. And just a reminder that should the Russian Federation wish to deliver their intervention in the Russian language, I would kindly ask that it is said at a pace by which our interpretation services can interpret. Thank you very much. Russian Federation, just confirming that you would still be in a position to deliver your statement. You have the floor. Thank you. We might just try one more time with Russia, and should we not be able to connect, may I propose that we move to the next speaker and would come back to you. Russia, just again confirming that you have the floor. Thank you very much.
Вот все. Hello, can you hear me? Yes. Спасибо.
Thank you very much.
Уважаемые коллеги,
distinguished colleagues,
уважаемый господин председатель,
distinguished chairperson,
с первых дней выявления
since the first day when it was known that a new coronavirus surfaced, the WHO has ensured maximum full and open access to information about the virus. We'd also like to note the role of the coordinating role of the Euro-Regional Office of the WHO in providing timely information to the countries of the Euro-region about the spread of the virus. Given the situation throughout the world, this has become a very difficult period to face the pandemic, and this, of course, affects many different aspects. There has been information, development of recommendations covering different aspects of prevention and treatment of the virus. The WHO has published more than 200 different parts of technical guidance. And of course, Russian specialists participated in this work. The documents, which were developed by the WHO, were used by the Russian Federation's work to compile recommendations for workers in different sectors, for example, industry, transport, tourism, and others. Since the very beginning of COVID-19, we came up with a strategy to deal with this. Pursuant to the WHO recommendations and also the international health guidelines, we took a number of timely recommendations to implement them throughout the territory. We developed test systems and carried out diagnostics and ensured that all hospitals were prepared. Thanks to the hard work throughout a number of different activities to come up with material and technical assistance and to analyze the infection, we were able to avoid an increase in the transmission level and to keep the disease under control. Russia also was able to provide assistance to other countries. We, for example, carried out some different 15 special missions in 11 partner countries. We were able to give them tools and personal PPE, personal protection equipment. The Russian Federation, for its part, also provided assistance to the WHO. For example, our government center, called Vector, which is the Government Scientific Center for Virology and Biotechnology, was included in the WHO Registry of Labs, providing assistance to the organization. And this, of course, helped the partner countries that also didn't have this type of technology. The Russian Federation contributed more than $4.7 million for the financing for fighting the coronavirus and, of course, for assisting other countries. Given the pandemic, thanks to the scientific traditions of virology and other studies in the Russian Federation, we were able to create the first vaccine against the coronavirus in the world. Today, pursuant to a decision of the President of the Russian Federation, we have started a mass vaccine program. The General Director of the WHO mentioned this. And of course, the success of our efforts depend very much on our working together and following the requirements of the WHO to face this situation. The Russian Federation has sent the vaccine documentation to the WHO, and we're counting on a productive dialogue. We salute the WHO in its leading role, and we should all support it to fight the pandemic. I thank you very much for your kind attention.
Thank you very much. And now to Oman.
Chairperson, members of the EB, ladies and gentlemen, on behalf of the countries of the Eastern Mediterranean region, I would like to thank the Director General timely report on the COVID-19 response. The spread of SARS-CoV-2 has provided the opportunity for significant expansion in national laboratory networks, surveillance, epidemiological capacity, and research in the region over the last year. We are grateful for the support from WHO in the global COVID-19 response through its leadership, coordination, and active engagement with member states on strategic and technical guidance and operational support. We acknowledge WHO's efforts in leading global research and promoting evidence-based information about COVID-19 to limit the spread of false information. We also recognize WHO's efforts in advocating for and facilitating transport, equitable and timely access to quality, safe, affordable, and effective COVID-19 diagnostic, therapeutic, and vaccines, taking into account existing mechanisms and tools. The member states of the Eastern Mediterranean region reiterate our commitment to improve and scale up the COVID-19 response and would like to call on the Secretariat's concentrated effort to support member states in the following areas. 1, improve surveillance data systems and reporting to global platform to increase understanding of the epidemiological situation at global, regional, and country levels, including the emerging variants. 2, strengthen supply chain to ensure acquisition of equitable allocation and transport of sufficient quantities of critical items. 3, ensure COVID-19 vaccine distribution is equitable and covers the most vulnerable population globally and nationally. 4, member states should implement and regularly update national multi-sectoral COVID-19 action plans based on specific contexts, priorities, and epidemiological situation, while taking into account the needs and vulnerabilities of all population groups. 5, member states should provide timely, culturally, and evidence-based information to the community, including on relevant risks and measures that they can take to protect themselves, engage communities in all aspects of preparedness and response, and actively address rumors, misinformation, and stigmatization. 6, member states should continue to develop and maintain national capacities for the early identification, testing, isolation, care for diseases, and for tracing and cleaning of all contacts. 7, support member states in decision-making on social measures and movement restrictions, applying inclusive, transparent, and evidence-based process in order to protect lives and sustain livelihoods. 8, member states to ensure continuity of essential health services during COVID-19 pandemic, including access to essential medicine and vaccine, and allocation of adequate human and financial resources. Thank you very much.
Thank you very much, Vardhan. And now to Guyana, and then we shall move to interventions by those member states not represented on the board. Thank you, and Guyana, you have the floor. Guyana, just wishing to confirm that you would still be in a position to make your statement.
Thank you very much, Madam Moderator. Thank you very much, Madam Moderator. Guyana acknowledges the comprehensive report from the Director General and the status report on Agenda Item 14.1. We would like to commend the Director General, Dr. Tedros, and his staff for their leadership in developing a multifaceted response to the pandemic, which has brought us much hope. To the world's population. We also want to thank the many persons who have contributed knowledge and resources to getting us thus far. Unfortunately, the pandemic is far from over. For us to successfully defeat the virus, it would require additional efforts and commitments to roll out safe and effective vaccines. We thank COVAX for their work, and we are happy to learn of the progress made in acquiring more than 2 billion doses of vaccines and the plans to start rolling out these vaccines by February. We commend COVAX for the work done so far, and I can assure you that all countries in the COVAX facility are anxiously awaiting their vaccine quotas. Guyana has been working very closely with COVAX over the last couple of months to ensure that we meet all the requirements for early rollout of vaccine. And in speaking with other stakeholders in the Americas region, they too are anxious for early rollout. We have all put the measures in place, both administratively, legally, and we are waiting the arrival of these vaccines. We hope as this process gets going, the WHO would assist us in developing a regional risk communication program to enhance the uptake of vaccines and to push back against the anti-vaxxers. In addition, we note with concern, the emergence and the spread of new variants of the virus. We will urge the WHO to assist poorer countries to get access to laboratories to do genetic sequencing. This would help member states to get a better understanding of the epidemic in their countries and for WHO to get a better understanding of how this virus is mutating and spreading. We thank you, and we look forward to participating in the other areas of this meeting.
Thank you very much, Guyana. We shall now move to statements by those member states not represented on the board. I should like to give the floor to New Zealand, to be followed by the Philippines and then Canada. Thank you, and New Zealand, you have the floor.
Chair, Aotearoa New Zealand appreciates the global and regional leadership shown by the WHO throughout the response to COVID-19. This includes the important support provided by the organization to our own Pacific region. We recognize the important role that the WHO member states in sharing information and expertise as we take together global pandemic. In this regard, New Zealand is the confidence of WHO independent scientific expert to China. It is vital that the mission has every to understand what happened, so that we learn from in order to the global health system and reduce future pandemics. We look forward to the successful mission and to the findings earliest. Chair, New Zealand, the global COVID, which will ensure COVID-19 vaccines are distributed equitably worldwide. Having all vulnerable populations vaccinated will make an important contribution to this pandemic. New Zealand has contributed 17 million New Zealand dollars in funding to support the COVAX Advanced Market Commitment, which will distribute doses to developing countries globally. It is critical that funding targets are met to ensure vaccines reach 20% of developing country populations by the end of 2021. Cooperation in the COVAX facility and AMC to date has been impressive and a precedent-setting example of global unity in the face of crisis. We look forward to seeing this cooperation and mutual support continue 2020.
Thank you very much, New Zealand. Unfortunately, the sound quality was not perfect. That being said, we would kindly ask that you send us a copy of the statement and we can ensure that it is posted on our website. And I should now like to give the floor to the Philippines, to be followed by Canada. Thank you.
Okay. Yeah. Thank you, Chair. Yeah. Can you hear me? Okay.
Yes. Thank you. Please proceed.
Okay. The Philippines expresses appreciation for the updates given today on COVID-19 and the response efforts from the global perspective. We appreciate as well the efforts placed towards support for making COVID-19 vaccines, diagnostics, and therapeutics accessible in an equitable manner and remain supportive of the solidarity effort in this regard. The Philippine delegation is proud of the work of our compatriots throughout the world, especially those in the migrant domestic and health workforce who have been actively engaged in the various front lines of the fight against COVID in their host countries. With this, allow us to emphasize that support to risk communication and community engagement is very critical in ensuring that medical professionals are fully equipped on vaccine administration, advocating the vaccination program, and encountering misinformation and disinformation surrounding vaccines. We also highly appreciate the technical and operational guidance on maintaining essential health services in the context of COVID-19. The Philippines fights COVID-19 while pushing our universal healthcare agenda forward to ensure holistic healthcare and adequate health system capacities. We value the different WHO platforms for imparting country responses. We have approached the response in our national context through an inter-health facility referral system, the One Hospital Command Center. The mechanism addresses the difficulty in getting patients transferred because of surge of cases being admitted in different hospitals and quarantine facilities. Through our continued collaboration with the WHO, among others, we hope to suppress the transmission of COVID-19 in our country, addressing emerging issues and protect our vulnerable population through equitable access to vaccines. Thank you.
Thank you very much to the Philippines. And before we do move to the remaining live member state interventions, I understand that we do have a pre-recorded statement from the Republic of Korea, who is also an EB member. We would just kindly ask that that statement would be played now. Thank you very much.
Us with additional updates on the progress of the WHA 73.1 resolution on COVID-19 response after the latest report during the special session of the WHO EB in October last year. The report reminded us of WHO's multidimensional effort, including the various technical support to individual countries, the delivery of PPE, and the response to the infodemic. I hope the vaccine supply of the COVAX facility will be accelerated as countries around the world are looking forward to receiving the promised doses of vaccines per ratio share in a swift manner. The smooth delivery of vaccines by the COVAX facility will help reverse the worrisome trend of vaccine nationalism. Following the principle of leaving no one behind, the support for vaccinations should be given to countries where medical systems have been overwhelmed. In particular, along with the help to establish a vaccine delivery plans on a national level, aids for the storage, handling, and transport of vaccines, which are typically difficult to distribute, are needed in countries with low capabilities. To that end, WHO will have to continuously cooperate with NGOs and stakeholders. Aside from vaccines, the equitable and prompt supply of diagnostics and therapeutics cannot be overemphasized. This is why the ACT accelerator has been launched, leading to significant progress in distributing diagnostics and therapeutics in developing countries. However, considering that there still remains a funding gap to be closed, standing in the way of WHO making consistent strides, further interest and participation from countries are required. Lastly, WHO should maintain its effort to share timely information and develop related guidelines regarding to emergence of the new strains of COVID-19. Following the WHA resolution, the Republic of Korea endorsed the activities of the IPPR, IHR, and IOAC that are conducting reviews based on scientific evidence and will consistently give support. We hope the committees will complete its review and finalize its recommendations by the timeline set for the next WHA. The Republic of Korea will continue to closely work with WHO and our partners to put an end to the COVID-19 pandemic. Thank you.
Thank you, Minister Kim, Republic of Korea. And we shall now return to those live interventions. I should wish to give the floor again to Canada, to be followed by Norway. Thank you. And Canada, you have the floor.
Good afternoon, everyone.
Continue to appreciate DG Tedros, Mike Ryan, and indeed all WHO staff for their ongoing efforts to fight this pandemic while continuing to deliver on other critical global health priorities. The results achieved in the Secretariat's report demonstrate this clearly. This is a tough time for all of us. A year after the pandemic began, much of the world continues to struggle with the devastating impact of COVID-19. Almost 100 million cases and over 2 million deaths so far, more than double the numbers just 3 months ago, with record spikes now occurring in part due to the emergence of new and more infectious variants. In Canada, the situation remains dire. Our new daily cases have tripled since mid-October, and the national positivity rate has almost doubled since then. It is no understatement to say that we are all, infected or not, suffering from COVID fatigue. It is therefore no surprise that we are all excited about the arrival of a COVID-19 vaccine, even if many are frustrated with the relatively slow rollout of doses so far. 3 months ago, the prospect of a vaccine by the end of 2020 seemed remote. Thanks to a global scientific effort, it is here. Ensuring the successful and timely global rollout of COVID vaccines is critical. We urge the international community to continue cooperating on the manufacturing and distribution of vaccines and to support fair and equitable access. To this end, Canada has committed significant resources to support vaccine deployment in vulnerable countries and populations. We are pleased to be part of the COVAX facility and also that our Minister of International Development is a co-chair of the COVAX AMC engagement group. It is equally important that member states adopt an allocation framework for vaccine distribution that prioritizes the needs of vulnerable populations and frontline health workers. This is what we have done domestically, in close cooperation amongst federal, provincial, territorial, and municipal authorities. We have prioritized our Indigenous peoples, our elderly, especially those in institutional settings, our personal support workers, and our frontline medical staff. We are also guided by an equity-based and gender-responsive approach. Finally, we need to learn the lessons of this pandemic and make changes accordingly in global pandemic preparedness and response. Canada looks forward to discussions now and the lead up to WHA on this. One critical issue is how to prevent the spread of viruses from national to international environments. We are encouraged that the WHO-led mission to study the origins of this pandemic commenced last week. This is an important example of global scientific collaboration to improve global health security. We need to look forward, not just back, and ensure that we learn now. What we learn now helps the international community to adopt more vigorously a One Health approach to global health emergency preparedness and response. Finally, again, we also encourage WHO to continue to regularly and meaningfully engage member states in guiding the directions of the organization. Merci beaucoup.
Thank you very much, Canada. And now to Norway.
Chair, Norway, as all countries, relies on the WHO leadership in this pandemic. We commend the WHO for having taken leadership during the pandemic. The whole world benefits from the multilateral system and from having a strong, independent, and responsive WHO in times of crisis. We commend the way the organization has stepped up and taken leadership by coordinating and providing technical support for several global scientific studies. The pandemic also serves as a reminder of the importance of the WHO's normative role to the world, delivering guidance to all countries based on best scientific evidence is essential to managing the pandemic in the best way possible. Collaboration on all levels and among all actors involved is a prerequisite to get us out of this crisis, and broad support for global access to vaccine, diagnostics, and therapeutics through the Access to COVID-19 Tools Accelerator will be important. Let us all join forces in a global solidarity to mobilize efforts to stop this pandemic and to take the world out of this current crisis. Thank you.
Thank you very much, Norway. And I understand that we also have a statement from Romania, who would be an EB member. We would kindly ask that Romania would make that statement now. Thank you very much.
Mr. Chair, dear colleagues, Romania fully aligns itself with the EU and its member state statement. From the beginning of this pandemic, we all knew that it would represent a test on how well our health system are prepared, and that the fight against it would be not an easy one. Resilience of country's social, economic, and health system was very different, and a lot of work, solidarity, and changes of experience should be the subjects of strategic frameworks to deal with such challenges. Romania has continued its approach focused on testing and treating those who needed healthcare, prevention, strengthening the capacities of the national health system, and design a strategic plan of the vaccination campaign that we consider a matter of national security. Continuous awareness and information campaigns about COVID-19 and needed prevention measures, public health and non-pharmacological measures, sequential put in place in correlation with local and general epidemiological trends, succeeded to keep under control the pandemic in Romania among time. Romania has redirected more than half of its budget for international development cooperation to respond to the COVID-19 pandemic, with special emphasis on the consolidation, the institutional capacity of health system, as well as countering fake in the COVID-19 context. Simultaneously, in the national territory, the refugees and asylum seekers were included in the national public health coverage, and thus their access to all necessary medical facilities was ensured. As a member state of the EU, Romania has committed through Team Europe to contribute on the global and multi-sectoral levels to the efforts of countering the pandemic, including the Act A initiative and the support for the COVAX facility and the EU participation to the AMC. We have reached a very important point in our fight against the pandemic, with a real chance of getting good results this year. It is very important to keep the momentum and, at the same time, to continue the implementation of the public health measures that have proven their efficiency and the organization of the immunization campaign. It is very important also to ensure the respect of the human rights, a fundamental element needed for the success of the public health response and recovery from the pandemic. Thank you very much.
Thank you, Romania. And now to Turkey, to be followed by Brazil. Turkey, you have the floor.
Thank you, Chair. Since the beginning of the pandemic, WHO has been the primary global information source. While it provided guidance on existing knowledge, WHO also worked hard to fight misinformation. Chair, one of the most important deficits the COVID-19 pandemic has revealed is the lack of a global crisis management mechanism for medical supplies such as personal protective equipment. Chaos begins in the absence of order. We have witnessed that at the beginning of the pandemic, as many countries experienced shortages of PPE. It is obvious that we need to build a mechanism for medical supplies to avoid such crises in the future. Global access to effective COVID-19 vaccines will be essential to end the pandemic. We commend researchers for their great efforts as we witness promising results from trials. We also appreciate WHO for accelerating the emergency use listing procedure for COVID-19 vaccines. We hope the list will expand. The pandemic reminded us the importance of capacity building and technical support. We invite WHO to make possible every effort to enhance activities of the WHO office in Istanbul, which is the geographically dispersed office established for humanitarian and health emergencies. We believe this office will be beneficial not only for the European region, but for all regions as it bridges a crucial gap. Last but not least, we would like to express our great appreciation to health and care workers who generously sacrifice themselves to fight against COVID-19. We invite all member states and WHO Secretariat to celebrate 2021 as the International Year of Health and Care Workers thoroughly. Thank you very much.
Thank you very much. And now to Brazil, to be followed by Denmark.
Thank you, Madam Moderator. Mr. Chair, let me reaffirm Brazil's solidarity to those who have lost their loved ones and to all health workers. COVID-19 remains a world crisis with profound implications for health economies and societies. Brazil has been stressing the importance of protecting lives and livelihoods in our response. Our constitution was amended to allow for extraordinary disbursements to fight the pandemic. The federal government has mobilized almost $120 billion or near 10% of our GDP. 20 billion to strengthen the unified health system with human resources, supplies, medicines, ventilators, diagnostic tests, ICU beds, PPEs, as well as to finance vaccines research, development, 20 billion in direct transfers to states and municipalities whose health-related responsibilities to fight COVID-19 was confirmed by the Supreme Court. More than $10 billion to shield the workers' revenues from lowered salaries or working hours and to support business activities, in particular of micro, small, and medium-sized enterprises. And approximately $60 billion has financed an ambitious program of cash transfer. More than 65 million people are benefiting from the emergency allowance. Mr. Chair, Brazil has also joined the international efforts to promote the equitable access to COVID-19 products and technologies. We are in the Facilitation Council of the ACT Accelerator. We are in the COVAX facility. We co-sponsor the CTAP, and we have participated in the solidarity trials. Mr. Chair, health systems are under pressure in many countries. In Brazil, Manaus, the capital of the state of Amazonas, faces a strong and sudden resurgence. The federal government is actively engaged. Federal resources transferred to the state amounted to $3.5 billion in 2020. The Minister of Health was in the city last week. A national task force is working to help restore the local health system's capacity. With the support of the Air Force and in partnership with the state, other public entities, and the private sector, the lack of oxygen supply has been substantially reduced. Mr. Chair, yesterday, Brazil's regulatory agency, Anvisa, granted emergency authorization for the use of 2 vaccines against COVID-19. Today, the federal government has initiated the distribution of a batch of 6 million doses of COVID-19 vaccines to all states. At this critical juncture, this executive board should make a strong call on members, WHO, other international entities, and the pharmaceutical companies to deliver in full and as a matter of urgency on their pledges and commitments to the fair and equitable distribution of COVID vaccines everywhere. Thank you.
Thank you. And now to Denmark, to be followed by Portugal.
Members of the Executive Board, delegates, Director General. Since this is the first time for Denmark to speak, we wish everyone a Happy New Year. Denmark fully aligns itself with the statement made on behalf of the EU and its member states. The world is still in the midst of fighting the COVID-19 pandemic. This is also the case in Denmark. In this statement, I would like to focus specifically on the important issues of misleading information. The pandemic has reiterated the necessity, but also the benefits of providing clear, transparent, available, and evidence-based information to the public that is easy to understand and to comply with. In a digital world, news and information travel fast, and the load of information is often vast and can be confusing. Therefore, there is a growing need to work with infodemics and to fight false and misleading information. We are pleased that the WHO is taking this task seriously. We commend the initiatives initiated during the COVID-19 pandemic, but also the ambitions put forward in the draft program budget of 2022 and 2023. Thank you.
Thank you. And now to Portugal, to be followed by Uruguay.
Thank you, Madam Moderator. Mr. Chair, Director General, Excellencies, Portugal aligns itself with the statements previously made on behalf of the EU countries. We underline the importance of strengthening preparedness mechanisms and essential public health services to boost readiness in the face of health emergencies. As these emergencies are bound to happen more often, we highlight the importance of the preparedness, response, and recovery cycle. The current pandemic highlights the need to build resilient health systems, providing a competent response to all spectrum of diseases while avoiding disproportional negative impacts on individuals and population, ensuring that equity, gender balance, and mental health outcomes and rights are taken into consideration. Portugal is committed to seize this window of opportunity and urges all member states to move towards a global sustainable development approach in line with the SDGs and with the guidance of WHO, assuring that no one is left behind, including migrants, conflict zones, and refugee camps. Mr. Chair, the IHR, transparency, and communication channels should serve as the basis and means to respond to health emergencies. We look forward to regular, participated, and in-depth updates on the progress of the Universal Health and Preparedness Review implementation. The rule, hope for the best and prepare for the worst, and a task usually attributed to Portuguese author Fernando Pessoa, sums up our collective intentions for the future. The year 2021 is still full of challenges to counter this pandemic, and we must redouble our efforts and support for solidarity and multilateral action coordinated by WHO. Thank you.
Thank you very much. And now to Uruguay, to be followed by Japan.
Good afternoon. Speaking on behalf of the Public Health Ministry of the Republic of Uruguay, the Minister and the Sub-Secretary, we would like to thank you for this invitation and convey our greetings to all the other members of the EB. We have drawn up a strategy against the pandemic, which has three components: leadership, management, and implementation. We carried out a quick diagnosis of the COVID situation in the country to begin with, and we set up centers to deal with it. We also provided further training to health personnel. We have boosted the number of ICU beds in our hospitals, and we are now looking to build on that. Our public and private clinics and hospitals, including care homes and old people's homes, have been covered so that they can be provided with constant support and assistance. We have managed to boost our capacity to carry out diagnosis through using PCR tests, and we've boosted the number of laboratories able to do this across the country. We've also boosted contact tracing. Since the beginning of the pandemic, we've encouraged the wearing of masks. We've also boosted the teams of contact tracers that we have so that they have greater capacity, and we are applying the experience we've had with other disease outbreaks. We have reliable data, we provide it and use it transparently, and that boosts confidence. Our pandemic strategy has been based and focused on the individuals and their medical and psychosocial needs, and to this end we have set up a mental health hotline which has received thousands of calls. We provide free care on mental health problems related to the COVID pandemic to people who are most vulnerable, particularly the very lonely and the very old and isolated. We believe this to be essential. In Uruguay, we have teams of professionals who also deal with other similar issues, such as, for example, domestic violence, which has been a problem during the pandemic. We're now moving on to a vaccination campaign and designing that, and we will be focusing above all, first of all, on the most vulnerable groups in the population. We'll be ready to go as soon as the vaccine reaches Uruguay. Solidarity is the basis of any success here, and so is equitable access to the diagnosis, therapeutics, and vaccines available. This has been one of the biggest global health crises most of us have ever seen. We are grateful for what we can do to help us get out of it, and we hope we'll be able to reach the end of it very soon. Thank you.
Thank you very much. And now to Japan.
Thank you, Chair. Japan welcomed the report submitted by the Secretariat. We appreciate WHO to play an important role to coordinate international response in the current situation. The international team of scientists has arrived in China to start research on origins of the virus and the transmission route to human. We wish to reiterate the importance of the international expert team to be able to access all the necessary studies and information to conduct a scientific, objective, and transparent investigation. We anticipate that the investigation fully achieves the intended purpose and discovers scientific findings. Here, I have 3 points to highlight. First, we appreciate weekly briefings and guidance provided by the Secretariat, and in this regard, we request the Secretariat to continue to provide consistent information based on science and evidence. Second, Japan believes it is necessary to review and clarify the role of WHO in the event of public health emergencies and strengthen its transparency and accountability. We hope the WHO maintains its central role in overall coordination, swift norm settings, and technical advice during a health crisis. Furthermore, in terms of operation, resource mobilization, research and development, we hope the WHO to enhance strategic collaboration with other UN agencies such as UNICEF, UNDP, philanthropies, civil society, and private sector, considering the frameworks including ACT Accelerator. Finally, Japan wishes the WHO to continue to support essential health services and preventive public health measures and to strengthen health systems during COVID-19 response. Thank you very much.
Thank you very much. And now to Pakistan, to be followed by Myanmar.
Thank you, Madam Moderator, Mr. Chairman, and honorable delegates. COVID-19 pandemic has impacted the world in an unprecedented manner, blurring the distinction between developed and underdeveloped health systems. Let me therefore begin by commending the very proactive role played by WHO in supporting the countries across the globe since the beginning of the pandemic. However, being a developing country did not impair Pakistan's ability to mount a robust and timely response to the biggest health emergency of our times. We were fortunate that the COVID-19 first wave was responded effectively to a large extent, and economic and social activities mostly revived. However, second wave is still prevailing, with no time for us for any kind of apathy or complacency. Since the reporting of the first cases on 26th of February, so far, our case tally has crossed 500,000, with almost 11,000 deaths as of today. Government of Pakistan adopted a comprehensive and multi-pronged approach at the strategic level and aligned these strategic decisions across the implementation processes in the country. The COVID-19 Pakistan Pandemic Preparedness and Response Plan was devised in line with the National Action Plan for Coronavirus Disease in Pakistan and the WHO's Strategic Preparedness and Response Plan. Mr. Chairman, Government of Pakistan established National Coordination Committee as the key body for policy and decision making, led by the Prime Minister himself. To assist this National Coordination Committee and to implement its decisions, a National Command and Operation Centers was also established. We therefore adopted a whole of the government approach across the country through a coordinated mechanism, which is still fully functional for response to the COVID-19 outbreaks across the country. Our strategies to combat COVID-19 pandemic revolve around the core pillars: slowing down the spread of the disease, using all kinds of measures, right from smart lockdowns to testing, tracing, and quarantine, implementation of SOPs and guidelines, and of course, very quickly expanding and improving the capacity from a single diagnostic laboratory at the National Institute of Health to 138 labs across the country now, ramping up the healthcare facilities, especially providing an additional almost 3,000 beds equipped across the country to provide adequate treatment facilities, along with equipment and supplies, ensuring medical oxygen supply, establishing a resource management system to capture and quantify essential equipment as well as supplies data. We also went on to prepare a National Health Emergency and Response Act 2020 in order to provide the legislative support to all the activities and efforts that we were undertaking. We kept on working on the capacity building of our healthcare workers in particular, Our Prime Minister's fiscal stimulus package of 50 billion Pakistani rupees proved to be essential for early COVID response. In addition, our federal and provincial governments are still providing additional financial support for the smooth ongoing country's response and preparedness. In terms of our efforts for streamlining data collection, analysis, reporting, and dissemination, we used a very effective polio surveillance and response system under the umbrella of the network of the National Emergency Operation Centers. We also try to minimize the sufferings of our people by use of the telemedicine very, very effectively. And now, last but not the least, we also have developed a very comprehensive COVID vaccine strategy. And in this context, we really appreciate the COVAX initiative, which is striving all out to ensure equitable provision of the vaccines to all countries across the globe. As of today, we have also accorded emergency use authorization to 2 of the vaccines. Mr. Chairman, we would like to thank the independent panel for its thorough review of the evidence thus far, identifying lessons and opportunities to ensure our international systems are better prepared for future pandemics is an extremely important task. We look forward to the report the independent panel will produce for the World Health Assembly. As this complex pandemic continues to evolve, to ensure our collective understanding is as comprehensive as possible, the government of Pakistan would like to express our consideration that the independent panel should possibly continue its functions beyond the World Health
Assembly. For the interruption. We would just kindly ask that you conclude your statement. Thank you very much.
I would just like to conclude by extending my appreciation to WHO for the detailed report and also all the efforts to promote the achievement of the highest sustainable levels of health for all, aiming to strengthen and build IHR core capacities to deal with the health threats and emergency. Thank you once again.
Thank you very much. And now to Myanmar, to be followed by Thailand.
Expressing our profound thanks to the Director General for his all-inclusive report on the COVID-19 response, EP/148/16. On behalf of my delegation, I wish to express our appreciation to the Director General and the leadership team for their leading role and tireless efforts in fighting against the COVID-19 pandemic. We are also obliged to the WHO for its international capacity and technical support through the Global Outbreak Alert and Response Network. Since the beginning of the pandemic, Myanmar has taken timely actions, especially in the prevention, control, and sustained efforts to curb the emerging threats of COVID-19 in the country. Myanmar has put in place a whole-of-nation approach and the principle of no one left behind to address this emerging challenge. Myanmar has made necessary preparations in order to attain the COVID-19 vaccines in cooperation with the WHO, Gavi, and COVAX facility. We have also initiated the vaccination program in line with the WHO's guidelines, including the WHO guidance on national deployment and vaccination plan. Mr. Chair, developing countries are now facing immense challenges in accessing the much-needed vaccine. It is therefore imperative to have fair and equitable accessibility and affordability of vaccines for everyone. To this end, we are grateful to the WHO for initiating a global collaboration to equitable access to COVID-19 diagnostics, therapeutics, and vaccines. We firmly believe that the COVAX facility is a great hope for low and middle-income countries to acquire effective vaccines. Since Myanmar is one of the COVAX AMEC participants, we attach great importance to secure substantial supplies of vaccines to cater for developing economies through the COVAX. Myanmar always attached great importance to her cooperation with the WHO. I therefore wish to reaffirm our continued support to the leading role of the WHO in tackling the COVID-19 pandemic. Thank you, Mr. Chair.
Thank you very much. And now to Thailand, to be followed by Belarus.
Thank you, Chair. As this is the first time that Thailand take the floor, this is the umbrella of appreciation to all secretariat in developing the report of our agenda. We will not mention about this again in other agenda. At this stage, Thailand would like to underscore 5 important issues. First, COVID-19 pandemic has huge impact globally. Thus, the preparedness and response are far from perfect. We need strong political commitment, leadership, international cooperation, and good governance to enhance capacity on health emergency preparedness and response. Second, timely information and knowledge sharing are critical, not only at country level. Global community need to share knowledge and epidemiology information in fighting the public health threat. We urge all member states to strengthen the collaboration in generating evidence, sharing information, and detecting misinformation. Third, protecting the healthcare and frontline workers to have adequate PPE is critically important. There is a need to ensure procurement, supply, equitable allocation of adequate PPE. Fourth, pandemic preparedness and response must be a priority of all countries. More importantly, country and global community have to provide adequate resource and responsive technical support to turn the commitment into real action. Lastly, Chair, no country is safe until every country is safe. Health security is global security. We need global response, multilateral approach, and constructive engagement of sector beyond health system boundary to overcome this pandemic together. Thank you, Chair.
Thank you very much. And now to Belarus, to be followed by Peru. Distinguished Chairperson, the delegation of delegates would like to thank the Director General for the report that has been presented, and would like to note that despite the continuing rise in disease incidence, it's quite clear that most countries have become more prepared for the challenges and have acquired a better gamut of know-how and tools to combat COVID-19. Much now depends on us, on our behavior, common sense in daily life. Belarus supports future efforts of the WHO to implement a package of measures to combat COVID-19. We warmly welcome the WHO-led platform of COVID partners to fight COVID-19. We believe that the regular updating of WHO's technical guidance on COVID-19 will be an effective beacon for national health systems. Following the recommendations of the WHO, we quickly developed in our country a comprehensive plan of action to fight COVID-19 for 2020-2021, as well as various response plans depending on the development of the situation. We are using best practices in epidemiological control, lab research, as well as patient care, and work at border entry points and international passenger transit points, and stockpiling of basic material technical means. We express our appreciation to the Euro Regional Country Office as well, rather the Euro Bureau and the Country Office in Belarus for the operational and technical support. We expect that the organization will strengthen its work on researching new variants of coronavirus and providing objective data on the efficacy and safety of new vaccines. Belarus supports the efforts of the organization to strengthen its response to emergencies. We thank you for your kind attention. Thank you. And now to Peru, to be followed by Malaysia.
Hello. Thank you, Chair. ¿Me escuchan?
Can you hear me?
Yes, thank you. Please proceed. Gracias.
Thank you. First of all, may I express Peru's solidarity with all those who have lost their nearest and dearest or who have been affected by the COVID-19 pandemic. We'd also like to express our warmest gratitude to those who fight so hard day by day on the front line to help us deal with the situation. We recognize WHO's efforts to help countries tackle with the pandemic, and we believe it is the responsibility of member states of all of the organization to do the same. With the advice of the organization and the support of the Secretariat, to reach agreements which will help us to improve preparedness and response to this pandemic and to those that there may be in the future, as well as to implementing the IHRs. Peru would like to reiterate its belief in the need to strengthen multilateralism, because this will ensure that we can have a better international governance of world health, and it will help us achieve universal health coverage. We know that that is a sine qua non for sustainable development. In committing itself to multilateralism, Peru, in September last year, joined the COVAX facility set up by the WHO, Gavi, and CEPI to ensure that vaccines would be accessible to everybody. It is absolutely essential, if we are to strengthen WHO's leadership, to have the COVAX facility achieve its objectives. All countries participating in it should be able to have access to vaccines in the shortest possible time, irrespective of their level of income. This goes for low-income countries and medium-income countries such as Peru, who is participating on a self-financing basis. We believe that the increasing number of vaccines and treatments against COVID-19 need to be recognized and treated as a global good, without which we won't be able to bring the pandemic to an end. The weaknesses that we had in our preparedness and response systems have been used by COVID-19 to lead us into a multi-dimensional crisis, which is having a very serious impact on our health systems. At the same time, it's putting at risk the sustainability of most of the health-related achievements that we've had in the last few years. Many countries are now facing the second wave of the pandemic, and it's having a worse impact than the first did, especially in terms of mortality and morbidity. That being the case, support from PAHO and WHO continue to be absolutely critical if we are to meet the health challenges we are now being faced with, and that includes continuing to provide basic, regular health services on matters other than COVID-19 to our peoples and populations. Thank you.
Thank you. And now, Malaysia, you have the floor.
Thank you, Chair. Malaysia takes note and thanks the Director General for the report, which has summarized continuing programs and activities undertaken by WHO and partners on the response to COVID-19. In Malaysia, both primary care and hospital services have played an exceptionally cardinal role in the health response generated. They've covered screening of suspected cases, laboratory testing of clinical samples, contact tracing, right up to providing medical care for the hospitalized patients. Malaysia further intensified our efforts to upgrade hospital capacities to avert the collapse of the already overstretched healthcare system. Despite being saturated with COVID cases, both primary care and hospital services have persevered in maintaining their existing essential healthcare services to patients while ensuring safety by adopting a myriad of innovative initiatives. In our attempts to tackle the soaring cases, the laboratory services have expanded to 62 laboratories across the country, involving not only MOH hospitals, but also university hospitals and private laboratories. At present, we are doing approximately 60,000 tests per day, and we are using the point-of-care testing, rapid test kit antigen, especially when it comes to mass screening of foreign workers within selected sectors and in managing outbreaks within resource-challenged areas. Indeed, effective communication is an important factor in Malaysia's attempt in managing the pandemic. Risk communication in Malaysia was strategized to assure the public and they're provided with consistent and accurate information in a timely manner. Evidence generated via information sharing among countries, regionally and internationally, has guided our policymakers to make evidence-based decisions. Malaysia would like to endorse this report and emphasizes that global solidarity is indeed the only way to win the war against COVID. We need unified responses to face this pandemic rather than diverse, disconnected strategy. Like Dr. Tedros said earlier, because until everyone is safe, no country is safe. Thank you, Chair, and terima kasih dari Malaysia.
Thank you very much. And now to Spain, to be followed by Ecuador. I understand we'll now have Spain.
Estimado Presidente, Chairman, Director General, ladies and gentlemen, Spain would like to subscribe to the statement made by the European Union and express our thanks for the Director General's report. We are grateful to WHO for her support and advice on the response to the most serious pandemic which mankind has suffered in the last 100 years. We acknowledge the leadership of the organization and its Director General as part of the UN system's multilateral response to COVID-19 and other global health challenges. Throughout the pandemic, WHO has made available to its member states all the resources and information it has on issues such as surveillance, best lab practices, infection control and prevention measures, clinical management of cases, preparedness, and border controls. It's also organized many meetings of experts in order to further communication and exchange between researchers and scientific institutions. We've been able to see the fruits of that intensive work. We've also been able to see how important it is to build consensus, to cooperate, and to demonstrate global solidarity. Initiatives such as Act A, COVAX, data and information exchange, and the ongoing evaluation of the response to the pandemic, as well as the international health regulations, not to mention the investigation into the origin of the virus, are excellent examples of how WHO and her member states can cooperate, boost capacity, and strengthen mutual trust. We will come stronger out of this fight against SARS-CoV-2 if we learn from our mistakes, apply the lessons we've learned, and are constructive. Thank you. Thank you, Chairman. The COVID-19 outbreak was declared on the 30th of January last year as being a health emergency of international concern. We went into emergency mode on the 16th of March and developed a preparedness and response plan with support and advice from the international community. We drew up our plan with the participation of the health authorities and other key parties involved in emergency response. Ecuador each year has reevaluated her capacity to apply the international health regulations, and we have used the self-evaluation tool for the submission of annual reports through the digital platform. This is there to make it easier to submit appropriate reports. Ecuador believes it is of crucial importance that we continue to work hand in hand on things such as developing further tools enabling us to fight more effectively against COVID-19 and ensuring that we can get equitable access to vaccines. The organization and its member states must continue to fight together, because if we do that, we will be able to bring an end to the pandemic and save the lives of millions. Thank you.
Thank you very much to all of the member states for these interventions. I should now have the pleasure of handing back to His Excellency and to Mr. Chair. Thank you.
Excellencies, distinguished delegates, we have come to an end of today's discussions. I thank you for the rich and productive discussions We will reconvene tomorrow at 10 a.m. Central European Time and resume EB 148 discussions. Thank you.